without them. They work tirelessly to create our agenda and arrange for speakers and sponsors. So thank you to Tiffany Gibson, Kayla Robinson, Rebecca Morgan, and Lauren Robinson. And also a special thanks to Breck Turner, who created our new conference website. And a big thanks to our sponsors, TDS Health, StatRef, Primal Pictures, and Board Vitals. So 2021 has been an interesting year. Some might say that we are emerging on the other side, but with variant strains on the increase, there are still really many unknowns. So in the midst of 2020 and 2021, I was very encouraged to see all of the productive and creative projects that many of you have worked on. This has been a challenging time, but we've persevered and we've been able to fulfill our library's goals and provide excellent services to our users. So today is an opportunity for us to share and to learn with our colleagues. And I encourage everyone to participate in the discussion and exchange of ideas by asking questions and engaging with the presenters during the Q&A portions. So before we get started, I want to briefly touch on a few logistics. So we are monitoring the chat for questions, so please use that feature when you ask questions. The 12 to 1 lunch break on the agenda is on your own. So feel free to step away from your computers and take a break, but you don't need to leave the meeting. You don't need to leave the Zoom room. If you do need to attend on and off throughout the day, you will be able to rejoin the meeting if you leave it. Just use the link that was provided. And there will be times that we ask you to unmute yourselves or use the raise your hand feature in Zoom. So just be familiar with those things. And then when others are presenting, please mute microphones so that there's no distractions. So if you have any questions, feel free to put those in the chat. Otherwise, we'll just go ahead and get started with the program. So let me pull up the agenda. I have too many tabs open. So the first speaker on our agenda is Jessica Petrie from the University of Louisville, and she will be giving a KYVL update.
Good morning. It took me a minute. I also have too many tabs open and I couldn't dig all the way down and unmute myself, but I'm here. I am going to share a little bit about the funding model for KYVL. It has been hopelessly and gloriously confusing, and we think it's gotten better, and we want to be extra transparent about that. So as Stephanie said, I am Jessica Petrie. I'm Associate Director here at Kornhauser Health Sciences Library in charge of our Clinical Services program. And I represent special libraries on the funding work group for the Kentucky Virtual Library. Make sure my screen share starts. Yeah, there it goes. So like I said, we'll do an overview of the budget in general, how it's spent, where it comes from, and how we decided on that funding model, and then a little bit about how the transition to this funding model, where we are in that process. So as far as fiscal year 21, we had total revenues of over $4 million. 51% of that is from the membership, the individual members of the consortia. And then the Council for Post-Secondary Education contributes 1.6 million, and then KDLA has 12% of total revenue. And they're also currently paying for Ancestry.com for us. As far as the database goes, all of the member fees, except those that are designated for something else. So if you pay for a courier service, those funds go for your courier. But the member fees themselves, except those designated for anything other than that, mostly that's courier stuff, maybe Kentucky Digital Library. All of those member fees are applied to databases. The balance that's not covered through the members is shown as CPE, but the combined CPE and KDLA contributions represent about 38% savings off of the consortial prices that the memberships ultimately have to pay. But we are this tiny little teal piece. Well, specials are this tiny little teal piece that we can't really see. That is 2.1%. And the special libraries, as far as KYVL goes, that is mostly hospitals, but it also includes Fort Knox and Fort Campbell. And then when Keeneland was a member, Keeneland would fall in this group, all of that. I know we have a mix here at KMLA. So several of us have like weird split roles where we may fall under academics instead of the specials, but specials is what these slides are going to be focusing on, but I can touch on just about the more general stuff as well. Databases are 86% of the total expenditures for KYVL. The rest is staffing. So this other 5% of the other expenditures is staffing, travel for promoting KYVL, or when travel was a thing that happened. But employees, full-time staffing for KYVL is the bulk of that 5% there. And then the systems, that's 2%, is things like Easy Proxy and the LibGuides, SpringShare subscriptions, content DM, that kind of stuff for the systems that run KYVL. And then 7% goes to courier, but nobody's paying for a courier if you're not getting courier service. Database usage, we did have 410,000 database searches this past year, and the most consistent block of those for health sciences was PsycInfo, and then 18,000 full text downloads from KYVL. And that funding formula that I mentioned was hopelessly confusing in the past. In 2016, the funding work group was charged, and that's when I started on this work group, so that was an adventure. The funding work group was charged with coming up with a new formula, essentially, because the previous version of the formula was so hopelessly confusing that even the people on the work group didn't understand it. It was a matter of putting some numbers into an Excel workbook and seeing what came out, and that was what people's bills would be. And the behind the scenes calculations within the formulas, nobody understood. So as we were redoing it, we wanted to focus on making it as clear as possible, even if most of us can't do the math in our heads or anything like that, but to understand the concepts and the principles of how it's determined, to make that as transparent as possible. We wanted to focus on equity between our members, as opposed to kind of ideas of fairness, and a lot of funding models for consortia are based around flat base fees or things that give the kind of visible fairness without having that meaningful equity behind them. So we really wanted to focus on making it as equitable as possible and also sustainable as possible, because we want this to be predictable. We want people to understand going forward how it's been calculated and be able to kind of predict what they're going to pay in the future. So we are able to provide cost estimates at the time of invoicing. For the next year, we can tell you about what you're going to pay when you pay for this year's invoice. So that's one of the benefits of this new funding model is that it's significantly more predictable as well. So what those actual factors are for specials, it's going to be the base fee that we have. It's going to count instead of FTEs or population in the county like it would for academics or publics. We have staffed beds, and then we have a second component for factoring in discharges to kind of account for the variations between full-scale trauma center 24-hour inpatient services as opposed to a outpatient clinic or anything like that. So we have staff beds, and we also have discharges to offset those. We do, for all of our library types, we try to rely on publicly available data as much as possible for the sake of transparency and clarity for everybody. Unfortunately, for specials, that gets complicated because that data is not kept current in a publicly available way. We do have to pull some from the AHA directory for our hospitals. Fort Knox and Fort Campbell, they function more like a public, and then our academics are on this breakdown too. But mostly it's a matter of being able to explain, maybe not the exact calculations, but being able to say, yeah, there's going to be a base fee, and then it's going to be $5 per staffed bed, and then 10 cents a discharge. And that will be averaged on a 3-year, if I recall, a 3-year rolling average. So if you suddenly have a new tower added to your hospital, you're not going to have to absorb all of that cost all at once. It would be averaged out over time. And as far as the transition goes, this did start in 2016, and then we're almost done. But as we were transitioning, we put rules into place so it wasn't that giant sticker shock for people that were way out of formula in one direction, and also to gradually bring people into formula. So nobody pays less than they did the previous year. Everybody that was paying less than the new formula amount needs to reach it as soon as possible. But we did want to cap the maximum annual increase at 20%, unless that would be the only way to get them into the new formula within 5 years. And as of right now, we're in the 4th year of the new formula. And by next year, we're right on track. Everybody should be in formula under transition rules within the next year, or by the end of the next year. So estimates for year 5 will be delivered as you pay your current year invoices. The only ones we're expecting an increase for in terms of specials are Norton and St. Elizabeth and Baptist Health Louisville. Those are the only locations we anticipate any increases. And then after year 6, or starting in year 6, we're anticipating to only have kind of cost of living adjustment increases. So when the prices of database go up, there may be an increase with that. Or if somebody drops out and the consortia gets smaller and we have to divide the cost between fewer members, that there would be some increase with membership fees. But everybody will be in formula, so they should only be very, very incremental increases to keep up with. Inflation is the word that I was trying to get, and I ended up with cost of living, but to keep up with those kind of costs. And I do have time for questions if anybody has any. Unfortunately, everything I know is on the slides, so I don't know that I'll be able to give any extra information. But Alona, who is the executive director of KYVL, did say that you were welcome to contact her if you have any questions, and then my contact information is up here as well. And I haven't been looking at the chat. If anybody had any questions in there, you might have to unmute and tell me.
There's no questions in the chat so far.
Cool. I'll leave the slide up just for another second in case anybody wants to copy Alona's information down, and then I'll pull it and I'll just pop it in the chat in a little bit.
Great, thank you.
Thank you.
Right, so the agenda has us to have a break until 10:45. So I'm going to go ahead and use that time to refill my coffee cup. I need some more coffee this morning. So we will meet back here at 10:45 and we will get started with our first presentation. So check your emails, grab a quick bite to eat, and we will be back at 10:45. Sorry about that. Let me see if, Lauren, do you have the one that's not a recording?
Don't, like, they all have recording on them, don't they? Does it automatically play?
It did.
Okay, how about I just share where we don't put into presentation view?
Okay.
And I'll just share that really quick. Okay, give me 1 second.
Sorry.
I forgot that. Yeah, that was, yeah, sorry about that. Advanced sharing options. You'll see that okay?
Yes.
Okay, let me make this a little bit, there we go. Perfect.
Okay, so we'll get started back with the conference. And so the first presentation that we'll have today is meeting the needs and building institutional knowledge through diversity and research workshops. It's going to be presented by myself, Stephanie Henderson, the nursing librarian at the University of Kentucky, and my colleague, Lauren Robinson. Do you want to introduce yourself?
Sure. So I'm Lauren Robinson. I'm the medicine liaison librarian at the University of Kentucky.
All right, next slide, please. We developed this workshop series as a way to manage the increased workload and increase in complex questions that would often take a lot of our time. To provide some context, the University of Kentucky Medical Center Library has 4 library liaisons serving the colleges of pharmacy, medicine, nursing, public health, and health sciences, as well as the UK Healthcare Hospital. 2 librarians retired from these, and these positions weren't filled at the time of the workshop creation. We were approved for hiring an additional librarian, but that search was canceled due to COVID. So good news, update. We recently hired 2 new librarians and they will begin this fall. Since we had limited staffing at the time, we wanted to provide a way to meet our users' needs and deal with the increasing workload. We developed this plan of offering workshops on topics that we commonly get questions about. We would record the workshops and send the videos to users as a precursor to a consultation. So this would allow us more time between consultations and also allow the users to have a better understanding of the questions that they needed to ask regarding their research. So we'll begin the discussion by focusing on topic selection, COVID impact, and explain details regarding the process and marketing. To determine which workshops to offer, we looked at and discussed questions that we receive often over the past few years. So systematic reviews, Note, and PubMed were the most requested topics. We also included workshops that introduced new library users to our resources and specific databases. We wanted to address the knowledge gaps and provide some focused topics for our specific liaison areas. The MCL had always provided an in-person workshop class, an in-person EndNote class. And since our computer lab was closed due to COVID, we transitioned this to offer it via Zoom, as well as folded it into our research workshop series, offering monthly drop-in sessions on EndNote and accompanying tutorials. Our business librarian, we did invite guest lectures based on their expertise from the UK library system. We had our GIS librarian do 2 workshops, and we also had our business librarian do a couple of workshops on finding legal and statistical information. She was familiar with the information needs of the medical campus, as she had previously filled some instructional roles in public health. Our College of Agricultural library merged with our medical campus in the fall of 2020. And so for the spring of 2021, we invited our colleagues from the Ag Library to provide some workshops as well. So when planning the research workshop series, we had planned to offer a Zoom option. So we had always known we wanted to offer Zoom. Zoom has been used on the medical campus, and it's not new for us. Originally, we planned to hold the workshops in our Zoom-equipped conference room in the Medical Center Library. We had originally planned to record the sessions in order to use the videos as a pre-meeting resource for consults. This would allow us to manage our workload. We wanted to record the sessions for those participants who were unable to attend. So providing these information sessions was one way that we could increase engagement on a busy medical campus. Since the pandemic sent us all home, we were prepared to still offer the workshop series with a few minor issues that we'll be discussing during this presentation, during the presenting section. The all virtual workshop may have impacted our asynchronous views as well. We'll discuss this more in our evaluation section. So due to the nature of the healthcare environment and times available, we decided to schedule our research workshop series during the lunchtime slot of 12 to 1. So this is a common practice on our campus for other workshop events. We created a registration form using our university subscription to Qualtrics. The registration form asks for their name, their email, and their college affiliation. They were given the option of selecting one or all of the workshops. Email invitation with Zoom links were sent out to participants who registered in advance of the session, a week before the session. Zoom links were also on our website for those who happened upon it and didn't have time to register. We learned a few lessons with our registration form for the fall workshops. Our original registration form was organized so that participants could choose which workshop the month that they wanted to register for. And it was difficult to separate the individual data points when emailing calendar invites. So in the spring, we revised the form and allowed participants to select each workshop, not based on the month that they were held. So after the first month of our workshop, we decided to start emailing calendar invites. Based on the workflows of us and our colleagues, we felt that that might increase attendance. Previously, we had just emailed the link to the Zoom meeting room without a calendar invite. So we had a graduate assistant do the editing and recording of our workshops. We used an institutional subscription to Zoom. The Zoom links for the workshops were created using the Zoom account connected with our reference email. The sessions were presented and recorded using Zoom. After the sessions, the recordings were downloaded on a local Mac computer hard drive and then edited with iMovie. There were some minor edits in the beginning and the end of the sessions. Once the edits were complete, we then shared, they were shared with OneDrive to our library specialist, who then uploaded and edited the videos on YouTube. Our graduate assistant and a paraprofessional staff member did the brunt of this work, and it took about 1 to 2 hours per week when the workshops were scheduled. The YouTube videos were housed on our research workshop series website, and they were also included on other websites such as the nursing tutorials page and the systematic review guide. So following the workshops, registered participants were emailed a link to the recording and any relevant materials. So PowerPoints, handouts, any links that we put in the chat box, they were also sent, as well as an evaluation form. Our graduate assistant was tasked with this process. Another lesson learned during the creation of this workshop series is that it does take time and it is a lot of work. So while we created it to help manage our workload, we needed assistance from some of the, for some of the more administrative tasks. For marketing, we had a graduate assistant create flyers and icons to put on our website, like the one on this slide. We marketed the Medical Center Library page and on the UK Library's homepage. We had liaisons send information to their colleges and some targeted emails to residents and grad students. Faculty we worked with, administration in the Office of Research, and then we sent it to UK Healthcare to be included in an email newsletter. So the lessons learned for this step is next time we'll go through our marketing department to save some time. We did that in the spring, and as we're beginning to plan for the fall, we've reached out and contacted them. It was just more of a time saver to have them promote on social media and do other things that we weren't able to do. Great, so we created a website for our research workshop series, and we included the name, date, and Zoom links to the workshops. Once they were completed, we linked the recordings. We included any handouts of PowerPoints and any other relevant materials in the relevant materials section. And then there was navigation for the registration link, past recordings, and note help, and other important links. So these are some examples of the promotional flyers that were sent to targeted groups. We included the registration form, the URL to the web page, and an email address for any questions. So presenting this series over Zoom from home provided some benefits and a little bit of challenges. So we were able to learn some things about Zoom. Oh, Lauren, yeah, sorry, thanks. So we were able to learn some things about Zoom and virtual meetings because this pandemic started in March and our research workshop series started in August. So we learned, for example, that it's best to have a dedicated person to monitor the chat and to add relevant links and to remember to hit the record button. All of those things were super helpful. The presenter had the ability to share the screen, which was quite useful for database demonstrations. For example, we were able to show that what Browsing, the mobile app, would look like on an iPhone screen via screencasting via Zoom. So that was really useful for demonstrating Browsing. Offering these sessions from home would sometimes result in unstable Wi-Fi. So we were able to offset this by having a person on campus, whether it be a GA or the library specialist. We had them run the PowerPoint presentation while we presented. This seemed to work out better, and we encountered less Wi-Fi issues this way. So some of our lessons learned is that give plenty of time to create the workshop materials and don't wait until the last minute. It takes longer than anticipated. Divide the workshop divide the workshops among presenters based on their schedules. So for example, the medicine liaison has a really busy June and July. So she did the workshops in August and September. And then I did the workshops in October and November because I'm very busy with nursing classes in August and September. So create a schedule around those presenters' schedules and to help ensure that they have time to work on it and create quality research sessions. We also learned that to receive a completed evaluation form, we needed to add it to the chat box at the end of the session rather than emailing it later. We got more completed evaluations when they were in the chat box at the end of the session.
Okay, sorry about that. I was trying to mute my email because it was dinging, so I apologize for that little interruption there. So I'm going to talk about our evaluation. So this is mainly using our registration form as well as the post-workshop survey. And also we were able to collect some data from YouTube for asynchronous views. So over total attendance, this was until about April 30th. So this is not accounting for the summer views. We had 112 people attend synchronously and 376 view the videos afterwards during that whole time. So this really shows that having the YouTube channel with our videos on it really does help our users access the material. It also shows that when we do send this material as kind of like a pre-meeting activity for our consults, that people are watching these videos. So this one is unique registrations. So they were pretty steady between both the fall and the spring. The fall, we had about 40 people register. And in the spring, we had about 35 people register. So it's very, it pretty much stayed stable. I'm going to go on to the next slide. Oh, and one other thing about this one is that you saw in the previous slide that we had 112 people attend throughout both between both semesters, but both in the fall and the spring, that was only 75. So we did have people drop in to our sessions, even if they did not register. So still having them open seems like a beneficial option when we continue this in the fall. So this is just an interesting data point that we collected. For these are, again, these are only the people who registered for the event. So those are the ones we knew which college they were affiliated with. As you can see, 16 of those were in the College of Medicine. We also saw a number in the College of Nursing at 5. We had 8 for others. And by other, that could be the College of Health Science, which is a smaller college. It could be UK Healthcare. So that's kind of what the other means. And we also had people from the College of Public Health and the College of Agriculture, Food and Environment. And again, the College of Agriculture just recently joined the Med Center. So it's really nice to see that we did have some participation from that college in the workshop series. So we also wanted to look at which workshops were the most attended. So for the fall, of course, the most attended one was PubMed Basics. That's not really surprising to us. We marketed that workshop as like learn the new PubMed. It was soon after the new PubMed launched. So we had a lot of people attend for that reason. Also, in the fall, we have a lot of new students and new residents who might be used to other databases. So we do offer that one, and we are planning to offer that one again in the fall. The next one was the introduction to the Medical Center Library. We marketed this during our orientation session, so it's not surprising that again is one of our top attended sessions. Then there's Advanced PubMed searching, which goes into more in-depth searching. Our time-saving tips and tricks was a really well-received one. We talked about things like libpnomad, EndNote Click, browsing, and I actually used my phone during that one to show some of the mobile apps that are accessible to our users. And then translating searches for systematic reviews, which is a really interesting one that one has been the top, was in the top attended one as well. Our spring top attended workshops were a little bit different. We offered a lot of systematic review sessions in the fall. And this spring, we offered some of the same ones like PubMed Basics and the time-saving tips and tricks. We also added more database specific tools. And that's also when we asked people from the science library, which is our GIS librarian, to come in and do trainings. So you can see here that some of these are more database specific, like Web of Science and Agricola, which were taught by our College of Agriculture colleagues. And then Social Explorer and the GIS Story Map were taught by Sarah Watson, our GIS specialist. And again, the time-saving tips and trick and PubMed were some of the top attended ones in the spring. So this is our LibGuide view from August 1st to April 26th. So you can see that overall it's been viewed quite a lot. That is the screenshot we showed you previously. It's where all of our workshop videos live, as well as on our YouTube playlist there, but it also lives on our guide. So everything is kind of linked in one place so users can come back again and again. As for feedback, 100% of those who completed the post-workshops survey said that the content met their expectations, and 100% of them said that they learned something new, which is great. So we're glad to hear that. And then this was some of our general feedback that we got. As a new user to UK Libraries, this was an incredible, helpful session. I appreciated the thorough explanation on how to use certain terms and filters when performing advanced searching. And I would like to join more sessions like these. I did not realize how many systematic review resources were available at the Medical Center Library. I think that was a very common response. Even when we have our consults, people are quite surprised by that. And then this person said they weren't particularly familiar with MCL, but the browser plugins and apps for accessing journals is quite exciting. And then there was some more feedback here. They weren't familiar with mesh terms and didn't realize how easy it was to filter through articles using those. Learning how to narrow expansive searches using mesh has saved time for this user. And then each of the lunch and learn sessions were very helpful in learning about different resources and services offered by the medical center. The tutorials were also extremely helpful. I had no idea PubMed had so many different features. So again, all the feedback was really positive. And then, so going into our future directions, we're going to be continuing the workshop series in the fall and in the spring. We want to provide more research-specific workshops, mainly because some of the database ones, though attended well, weren't as highly attended as some of the research-specific workshops. So we're hoping to kind of take that thread and keep going. We are going to be redoing some of the database ones, like Web of Science just launched a new platform. So if there's a new platform, we are going to be planning to do workshops on those databases. We want to create more active titles for the workshops. So like Elevate Your Research is what we called one in the spring, and that one had a lot of attendance, while just Research and Publishing in Health Sciences, it was the same session in the fall, didn't have as much attendance. So we really want to recreate some of our workshop titles to make them more active. And then we also want to change how we promote, which Stephanie touched on previously. We want to promote them using our marketing department, and we also want to add them and kind of reach out earlier. So for example, I sent my stuff out in the orientation sessions to the College of Medicine's residents. So just trying to get that stuff out earlier. And we also want to consider partnerships. So we kind of started that in the spring, but where else can we go? Can we partner with different colleges and different groups across campus to help provide resources in our workshop series? So That's all of the information about our feedback and the future directions. We want to take a moment to thank Kayla Robinson, the past Medical Center Library Graduate Assistant, and Brett Turner, the library specialist, for all their work. They really helped us get everything uploaded, edited. So again, thank you to them. So, and we have some time for questions, I believe.
Hey, this is Becky. There's nothing in the chat, but I actually have a question. Did you notice that you had a lot of return patrons, like people who wanted to go learn about multiple databases, or if someone attended one, they were more likely to attend others, or was it really a mixed bag each time depending on how you promoted it?
A lot of people registered for all of them. Like they just filled out everything and then they came to the ones they could. So there wasn't really a good way in any of our data to really evaluate if people were repeat, other than if they registered for everything. Given how many views there were like on our YouTube videos, I'm guessing people did go back and watch some of that content. Just because it was triple, I think, from what our in-person view was over the two semesters. Stephanie, do you have anything to add?
Yeah, I mean, I remember a few, like a few specific people that came to almost all of them, but not everything else was pretty much a mixed bag of participants. That's kind of what I remember, but you know, it's vague.
Yeah, and I would add that a lot of them weren't really active workshops. They weren't, they were really meant like if people need to eat their lunch and wanted to watch something as a way to learn something new. So they weren't really active, though. We did do a Q&A systematic review one, which was, we got a lot of questions in that one. We kind of framed it. So that's not really answering your question in that regard, but I think that some people, so sometimes I didn't always notice if there were repeat people because there was not quite as active except for a few of them.
Great, thanks. And then I don't know if you saw in the chat, Ansley did ask, did anybody attend based on word of mouth from past attendees that you're aware of?
Yes, they did. Yeah.
Yeah, we specifically, we had, I remember a nursing graduate student, she told some people, and so then the people showed up, you know? So, and I know that we had some other people say, I'm going to tell my colleagues about this. I don't know if you remember any specific one, Lauren.
I don't remember specific ones. I feel like the Elevate Your Research people were saying they were going to tell people about these. We did a lot of tools like how to set up an ORCID ID and things like that that they need. They said they were going to share that one, but I don't know. I don't remember anything in particular, but I do know people said they were going to share it with their colleagues.
And I think that was one of our evaluation questions, if I remember correctly.
Would you recommend it or something like that?
Yeah.
Yeah, it was. Yeah.
And it was like all positive.
I'm not seeing any other questions in the chat, just so you know.
Okay. I think we're at time, right?
Yeah. Yep. Wonderful. So for the next session, this is going to be a round of lightning talks. And I would ask that you hold your questions until the end of both lightning talks, and then we'll do questions at the end for both participants. So the first lightning talk is going to be customizing services for visually impaired patrons, and that's going to be presented by Rebecca Morgan, clinical librarian at the University of Louisville. And I will introduce the second lightning talk after Rebecca goes.
All right, I'm going to go ahead and share my screen. And also, this is a change in the agenda. I asked if I could swap with Kayla. So thank you, Kayla, for agreeing to switch with me. My computer's being a little slow. Are you seeing my presentation and not like the notes portion? Awesome. Okay, so today I'm going to talk to you about customizing services for visually impaired patrons. And this is going to be based around a specific case that we are currently working on with Kornhauser. So this is going to be kind of a, as it's happening, lessons learned, some things that stuck out to me. This is something that is going to be ongoing for some time, but it's still such an interesting, unique case. I thought it'd be interesting to share. So a couple months ago, the reference desk was contacted by an incoming geriatrics fellow who is acutely visually impaired, if not completely blind. And he was curious about how he could access our online resources and ebooks and to know if they were compatible with the screen reader that he was using. He's also an interesting case because he's relatively newly blind. He's only been blind since about 2019, so he's not fully acclimated to using adaptive technology. And he was also a former U of L gastroenterologist and is switching fields to one that is hopefully more compatible with his impairment. So he was familiar with Kornhauser and the resources that are provided by a medical library in an academic medical setting. So that was also interesting. So thus far, I've been working with him for about 2 months, as I said. I've had several phone conferences with him and then one longer in-person meeting to try out using our various resources with a screen reader to see what worked best for him. And it has involved a lot of trial and error. So let's talk about some of the things that have stood out to me the most so far with working with him. First, this is not any criticism of our website, but pretty much every website that technically meets ADA compliance is not adequate for a screen reader. There are so many links because we are an information resource center that it's very hard to navigate through them in drop downs. I'm not saying that you should change your website to make sure that it is perfect for someone who's using a screen reader, but you should be willing to offer workarounds or potentially, offer some adaptations for them that might make it easier. In particular, we found that downloading apps onto a mobile device, because he primarily likes using an iPad because it has good voiceover or voice reader technology. So specific apps for like Dynamed Micromedics, Trip database browsing, having those on a folder on the front page of his iPad was the easiest way for him to access stuff readily. But it also worked to create an individual LibGuide with the most important links, including wherever possible, direct links to ebooks. So instead of having to navigate a large page, he is able to just go to this LibGuide and know exactly that the links are aligned along the left side of the page and be able to scroll down that way and access things much more quickly because he can just bookmark this LibGuide that is not public, but if he has the link saved, on his desktop, it's very readily accessible to him. And then there's also a lot of issues, understandably, with lit searching and article retrieval. In particular, PDFs tend, when they're provided by vendors, tend to mostly be readable by screen readers, but there are a lot that are just images. And so you really need to try and have someone, if you can, trained on staff who's able to convert PDFs. To be able to add the headers and the alt text and the markers that a screen reader would need as you move through text. And then also in some cases, we have just had to copy sections into a Word document and send it to him if that's like the only way he could read an abstract. Screen readers also do not read charts, tables, and images. So sometimes he is only looking for, lit review articles that might not have as comprehensive, charts and graphs and imagery like that, are decipherable, or in some cases he is only looking for the abstract discussion and results because he can't necessarily work through the methodology. He'll need someone to actually explain that to him or read it to him, which is not what we would do, but we can still provide pieces of the article that are useful to him. And then linked text is not always readable, and this is the most frustrating part. I think you always, whenever possible, do need to provide the full link. And I realize my LibGuide did not do that. I need to edit it to make sure it has that, because sometimes in his reader, and he says that he cannot figure out why it's happening, sometimes not others on the same page, it'll only read like Dynamed, and it won't understand that there's a link underneath it to actually get to the resource. So really sitting with the person and making sure that you are making sure everything actually works for them is the best way to really go. And so to sum up, just some of the lessons learned is definitely, if you can, practice with screen readers to learn what works and what doesn't. If you're going to be working with someone who's using these tools, it's really helpful to try and acclimate yourself to them, and iPhones and iPads do have them built in. I am going to be working with our technology librarian and our director to see about, getting screen reader technology at our library that we can provide. We're also going to be working with our disability office, which is, we realized we had never really been partnering with this whole time. And then also we made sure that it's not live yet, but we're adding an accessibility website for our specific library, not just the general one for university libraries. Because while it's great, there's one for university libraries, it's really leaning towards Extrim, our main library. And you really, even if it's just saying, contact us, here's a specific point of contact that you can reach out to. Here is, an accessible person at Kornhauser specifically that you can reach out to. That goes a long way to making us just an easier place to contact and easier to reach out to. And then also just don't assume, it's helpful or right. Don't just, suddenly spend a lot of money on, different adaptive technologies that might not be used. Really be willing to work with individuals or specialists in your disability office, if you have one, to make sure that your accommodations are actually appropriate and useful. And that is it for me.
Thank you, Rebecca. Our next lightning talk is titled, What If You Don't Have a Library? Information Outreach to Health Professionals. And this is going to be presented by Gina Genova, clinical librarian at the University of Louisville Kornhauser Library, and Riley Sumner, hospital librarian at the University of Louisville Hospital Roundtree Library.
All right. Hi, everyone. Gina, if you want to go ahead and pull up the slides, that'd be cool.
Yes, I am working on getting that. All right. Share. All right. Can everyone see it? Perfect.
Okay, wonderful. So like Stephanie said, we are presenting on what if you don't have a library, information outreach for health professionals. I'm Riley Sumner. I'm the hospital librarian at Roundtree Library, and presenting with me is Gina Genova. She's one of our new clinical librarians, and let's go ahead and get started. So just to give a little bit of background, like I said, I do work at the University of Louisville Hospital Library. So I'm contracted out by the hospital to provide university resources. So our hospital doesn't actually have access to databases like CINAHL or Web of Science or anything like that. They get all of their information through me. So in 2020, yes, the year of COVID. And a little bit before that, U of L Hospital partnered and took on an entire new hospital system. So we acquired Jewish Hospital, Peace, Mary and Elizabeth, and a few others. But because of that, we also needed to expand our library contract to include serving those institutions. Unfortunately, we're still having a lot of back and forth on how to expand our library services. So currently under our contract, we can only serve University of Louisville Hospital staff and patrons, which makes it a little dicey when I get people from Jewish Hospital or Mary and Elizabeth or Peace who want information, and under our contract, we can't provide them. So that led us to partnering with Gina and becoming a GMR Partner Outreach Library. And we decided to share what free resources that GMR could provide to those hospitals that didn't have a library. So that's kind of our little background. And the solution, thank you, Gina, was to provide a webinar for free resources. So Gina's going to go a little bit into more about what those resources were. So take it from here.
All right, so while we were planning the webinar, the first step was to narrow down what freely available resources would be most helpful to health professionals. And while we were planning, we kind of divided this into two categories. The first was NLM resources. This is because at the time, Kornhauser was a GMR Partner Outreach Library. So of course, part of our work with that was to increase awareness of all the resources that the National Library of Medicine has to offer. And then we also came up with just additional resources around the web that are useful for health professionals. So the NLM resources we settled on were PubMed Central, the NIH Drug Information Portal, clinicaltrials.gov, and Medline Plus. And Medline Plus it's not geared towards health professionals. It is a consumer health website, but we think it's a very useful website to make sure that health professionals are aware of, so that if patients or caregivers are asking for more information or where they can learn more about health topics, that's something that health professionals know that they can refer them to. And some additional resources that we decided to included the ECRI Guidelines Trust, which is a big repository of clinical guidelines, and most of them are free to download. We also included some CDC resources. For example, their collection of guidelines and recommendations from the CDC stats, and their travel health website, which contains a lot of information that would be relevant for clinical decision-making with travelers, and also the Directory of Open Access Journals section on medical journals. We also decided to include a brief demonstration of PubMed searching, because even though this webinar was not meant to be like a PubMed instruction session, PubMed is really useful for locating articles both in PubMed Central and in other open access journals. So we wanted to make sure that our participants were aware of this and knew the basics of navigating it. So most of this focused on keyword searching and using the filters, especially the free full text filter, to narrow down articles that you can access without library subscriptions, I'm sorry. And we also provided a brief introduction to MESH, where to find it, what it was, how to search for terms, just so if they were using keyword searching and that wasn't producing useful results, they knew that there was another tool they could use that could potentially refine those results to something that was more relevant. So we had the webinar ready. We had Riley market it because, as she mentioned, she is the hospital librarian. She is the point of contact for a lot of these health professionals who need information services but are not able to get them from their institutions or, unfortunately, from us. So she reached out to her contacts at those institutions to spread word about the webinar. We hosted it over Zoom. We had to because of COVID, and we probably would have anyway, just because when you're bringing together busy health professionals from multiple locations, it's a lot easier to ask them to hop on a Zoom call in their office than it is to come all the way to Kornhauser. And we then uploaded a recording to YouTube. We had a total of 6 health professionals from these Louisville hospitals attend, and we did receive an overall positive response from attendees. They expressed that the webinar was helpful, they plan to use some of the resources, but we didn't conduct any formal assessment. So our next steps going forward is one, that we plan to continue to offer the webinar on a regular basis, about 3-4 times a year, depending on our schedules and interest. 2 is to conduct a more formal assessments going forward. This would include like feedback surveys from the participants to get a good idea of what is and isn't working and potentially improve the webinar, and also to get our hands on any YouTube analytics from the person who manages the library's YouTube channel. And then 3 is to expand the marketing efforts, hopefully also to include health professionals from outside the Louisville Downtown Medical Center. So that is it. Thank you for listening to our presentation.
Thank you, Riley and Gina. So now we'll take questions for Riley, Gina, and Rebecca over there to Lightning Talks. You can put your questions in the chat, or just you can unmute yourself and ask your question if you would like. Okay, well, if there's no questions, if you all don't mind to provide your email addresses in the chat box, that way participants, maybe they will think of a question later, or maybe if they encounter a similar situation, they want to contact you for some of the workarounds and experiences that you've had. If you just drop your information in the chat, and then we'll now take a little bit of a break until 11:35 when our vendor presentation will begin. So we'll take a break now until 11:35.
And the project is easily undertaken in any setting and can be modified according to your own needs should you choose to do something similar. So just because I am in a public library and I am thinking about the general public in this, doesn't mean that it can't be tweaked for your audience. So a basic overview, we're going to be going through briefly what is graphic medicine for those of you who may not be familiar. And then talking about the project in particular, determining our community health needs, creating the kits, promoting them, any challenges, and then at the end, I'll leave some room for questions if you have them. So what is graphic medicine? I normally define it as the intersection of comics and medicine, or comics and healthcare. It's a phrase that was coined by Welsh physician Ian Williams in, I think, 2007. It's a fairly broad term, and many people have very different ideas about what is or is not considered graphic medicine. But for the purposes of today's presentation, just think of it as comics that contain a major health or wellness theme. And if you want to learn more after today's presentation, I recommend the 3 sources on this slide: the Graphic Medicine Facebook group, #GraphicMedicine on Twitter, and graphicmedicine.org. So I have a couple of examples that I'll show up on the screen just to give you sort of a visual. I find that to be helpful. I also have some physical books with me that I was going to hold up. I'm a little scared to leave the presentation because I don't trust myself to get it back the right way. So we'll just go with the 2 in the presentation. This is one example. It's a book called Mom's Cancer. I never know the correct way to pronounce Brian's last name, but it's by Brian Fies or Fees. And it's a comic that he wrote while watching his mother go through treatment for her cancer. And as you can see here, he has drawn her undertaking some chemotherapy. So graphic medicine can be something like this, where it's a person's memoir about their experience with something health or wellness related. It can also be something a little bit more straightforward, scientific nonfiction like this, A Shot in the Arm by Don Brown, which is a comic that's all about the history of vaccines. And you can see here one page that has to do with the smallpox vaccine. So it can be memoirs, it can be strict nonfiction, it can be anything in between. So when we were thinking about creating these kits, we applied for the grant through the National Network of Libraries of Medicine, which is for community outreach. I'm going to pop over, actually, I'm going to try this. I'm just going to show you the website where you can apply for this type of funding. They will fund so many projects, and it is one of the best grant experiences I've ever had. They are with you every step of the way in writing the grant. Their like restrictions on what you can or can't do are very relaxed and easy and understandable, and all of the follow-up is very easy to do. So let me see if I can switch it over here. Let me know if that worked. Perfect. So this is the website, which you may be familiar with already. It's nnlm.gov/funding. And I won't talk too much about it, but I highly recommend, if you want to do this kind of project or any other project with, you know, a dedicated audience and you need some money for it, try to get funding through NNLM because they're amazing. And now if we can get back over. So that worked, but it's not my presenter view. I'm so sorry. I knew I was going to mess that up. So let me go back. Oh my gosh, it's not like I've been using PowerPoint for like over a decade or anything. All right, how's that? Perfect. So we applied for this grant. NNLM already had a similar book club kits that they were using, and we wanted to replicate those here. And the reason we thought that that would be a good project for us to undertake, like I said, our strategic goals were specifically related to health and wellness in the community. And we saw these book discussion kits as a great way to spread reliable health information. Because each kit contains not only books, but a packet of materials from trustworthy health and wellness organizations that's curated by a librarian. So if the kit, for instance, is about anxiety and depression, our librarians put together, using NNLM resources, different materials about anxiety and depression, so that we're not only providing books to people, but we're giving them background reading or additional reading, so that they're not just understanding anxiety from like what they think or assume or have experienced themselves. They're seeing sort of like a holistic amount of information. And then starting conversations in the community. A lot of people are uncomfortable talking about health and wellness related things, especially here at the public library. Some people won't even come to a librarian to ask for information on those sorts of things. They want to be pretty independent. So these are a great way for people to explore on their own if they'd like, or to discuss with other people. And then building empathy, exposing people to new ideas, new themes, new experiences, things that they may not know about, and breaking stigmas around some of these things. So one of the examples I used in trying to promote these kits initially to one of our book clubs, who was kind of hesitant to read it once they realized it was a comic, is I asked them to imagine that someone they care about had just been diagnosed with bipolar, and they wanted to learn more about that diagnosis so that they understand what their friend is going through and can be there for them. And I said, you know, you can check out this book from the regular nonfiction collection, which is has a chapter about what bipolar is that's 30 pages long, or you can read this 3-page spread in Marbles by Ellen Forney, in which she visually draws and writes out what bipolar is. And it's the same information that's in the regular book, but a 10th of the length. And it being visual means that you're more likely also to retain that information. And that was really helpful. All of them agreed that, yes, they would rather read 3 pages instead of 30. And so the kits make the difficult topics more approachable for people. And for me, what was important, because I am the lead purchaser for graphic novels in my library, was to expose people to graphic novels who may not be reading them initially. So getting started, these 7 points were based on my experience and what I would encourage you to do if you decide to do a similar project. I'll go through all of them, but first I wanted to make a couple of points. Figuring out the logistics, I did not do until much later in the process, and that was a significant source of stress. So I recommend writing down every single person who may be impacted by the creation of these kits early on in your planning. So catalogers, materials management handlers, book club coordinators, if you have those, programming librarians. If you're doing it with faculty, reach out to those faculty members, or if you're doing it with a group of students, talk to them. And that way you're all on the same page. And if you're doing it with a grant, meet with your bookkeeper or whoever is going to be responsible for managing that money to figure out, ahead of time how you need to do it. The NNLM grants, the way they work is you have to spend the money and then they reimburse you. And it doesn't have to be in one lump sum. You can spend small amounts of it and get reimbursed as you go. But I didn't quite realize what sort of impact that would have on our bookkeeper who's trying to keep everything balanced. And so just take care of all of that at the beginning and make it much easier on yourself. And promote is on here twice. And that's intentional. I recommend that you get the word out about kits while you're waiting for the items to arrive. That could be especially helpful if you'd like to organize a discussion group for one of the kits, or if you want to work with an instructor to incorporate them into the curriculum. That way you can sort of talk about it ahead of time. If you already have graphic medicine titles in your circulating collection, you can kind of give them a heads up that these kits are on the way, and then provide them one of those circulating titles so that they can see what it's all about beforehand. And then once the kits are in, they're assembled, they're ready to go, promote them again more broadly to get the circulation. And another thing that we did is our head of publicity created this logo for us to brand all of our graphic medicine materials that you see on the left. And that made it really nice, especially because it was grant funded to sort of tie everything together. So the first thing we had to do was to figure out if we're going to create these kits, what themes do we want them to focus on? What are the major health and wellness needs in our community? Since our audience was the entire community of Darien, which is about 20,000 people, we used a community health needs assessment from the local hospital. And we found out through that assessment that in Darien, the major health concerns are mental health and substance abuse. So we knew that we wanted the books that we chose for the kits or the kits themselves to have elements of those in them. If you're focused on a different audience other than the general public, see what resources exist to give you data about the health needs of that community. If it's, a certain group of students, what are they covering in their courses, or what are they, struggling with on their own? If it's faculty, what are they teaching? What are their interests? All of those things. Think about interactions that you're having. What books are coming and going from the library? What books are being covered in courses? What reference questions do you get? What do people ask for? What are they talking about? And then think about cross promotion. For us, that meant thinking about whether there were successful programs already in the building that we could partner with. meditation programs, for instance, or chair yoga, or other programs that aren't necessarily health and wellness related, but kind of would tie in nicely. And think about, for you, what sort of like, where could you maybe build this into a place that already exists? Consider also your budget, where you're going to be storing and displaying these kits, and the time that you need to dedicate to the project and the personnel who will help you. So once you've identified your themes, I recommend these resources to identify the books to use in the kits. On the left is a link to a database of graphic medicine titles that's maintained by Alice Jaggers. Every time a graphic medicine title comes across her radar, she pops it into this database. You can sort by topic, by audience. There are many columns that you can sort of sort through to find the books that would fit your specific needs. And then once you identify those books, I recommend the resource on the right, which is graphicmedicine.org's comic reviews. So they have people who are affiliated with graphic medicine, whether they are practitioners or authors or librarians, etc., writing or like reading these graphic medicine titles and writing really good reviews on them so that you'll know, whether it's something that you actually want to share with your audience. I intentionally chose mostly graphic memoirs for our kits because in general, our community is like, they're avid memoir readers. So I knew that my best bet, especially if I was going to be trying to promote these to people who don't read comics on the regular, was going to be to make them memoirs, because that was going to be sort of my foot in the door. And you should do what works best for your community. So after that whole process, we created the following 11 kits: aging parents, Alzheimer's, anxiety and depression, childhood trauma, emergency preparedness, grief, LGBTQ, maternal health, mental health, practitioner perspectives, and veterans health. So it's 11 kits total, and each kit has 10 identical packets. So anywhere from 1 to 10 people can check them out, and you can see some of them in this picture. Inside the kit are the books, obviously. The NNLM kits that already existed, they contain one book, and the discussion questions are focused solely on that one book. We decided to put 2 books in ours, and that was for 2 reasons. The first is, as I already said, we have a very robust book club at our library. They are avid readers. Many of them are reading, like 300 to 500 page books for their book clubs. And I knew that I already had my work cut out for me in trying to transition some of those groups over to reading a comic or graphic novel. And so I wanted to give them 2 books, in part because it was more content for them to read. So it would feel to them like a better exchange. And then the second reason is the most important reason. I thought it was very important that 2 viewpoints or perspectives be represented in these kits. So in the mental health kit, for instance, I don't want our audience to read one person's memoir of bipolar and think that that means that everyone's experience with bipolar mirrors that person's experience. Because we were dealing in memoirs and not strict nonfiction, I thought it was important to show that different people can experience the same thing in very different ways. That's part of breaking down that stigma and getting those communications started. We also include a how-to sheet, which is literally just a 2-page comic about how to read a comic. If you are a comics reader regularly, it may feel to you like it's a very obvious thing, but it can be difficult to read a comic if you don't usually. So this is by Jessica Abel, who's an illustrator, and it literally just shows them what order to read the text in, explains how a comic is laid out, what certain things mean. It's very useful. We also include ready-to-go discussion questions that are written by our librarians. So we all read every single book that goes into these kits and sat down and wrote meaningful discussion questions. There's between 9 and 10 for each kit. Some of the questions are about one specific book in the kit, and some of the questions are about both books. At the bottom of the discussion questions, we also include a link to a survey for people to give feedback about the kits so that we can improve them moving forward. And then maybe the most important thing in the kit is the health materials. The most important thing as far as the grant is concerned. If you get a grant from NLM, you have to include their resources in some form or fashion. You have to point people to their resources. So what we do is we go to Medline Plus and other things that link out from there, and we gather information about that specific topic and put into the kit for people to keep. They have to bring back the bag and the books, but they get to keep all of the health materials. Things to consider, subtitled Things I Didn't Think About Soon Enough. These are just a few. There are many, many moving parts to a whole grant process and a project like this, but I'll talk about a few because the things you don't think about can end up being the most significant challenges that you face. So for instance, when I originally wrote this grant, I envisioned large cloth bags for the kits because for our regular book groups, most of the groups send one representative to pick up all the books at once, and then that person distributes them. And so I thought, well, this will work the same way. But there's a huge difference in picking up 10 books to distribute to your group and picking up 20 books and 10 discussion packets in one bag. That's not feasible. It's very heavy. It's not good. So I had budgeted for 11 bags, 11 large bags, and I found out that I needed 110 small bags, which is just a little bit different. I also was so excited at the idea of actually getting them into the collection that I didn't put much thought into where they would be stored. Like I did not visualize exactly how much space they would take up, or that they couldn't necessarily just be on a regular shelf because they're inside a bag. So think about that. I chose one book, American Widow, which is a woman's, again, memoir about losing her husband on September 11th, 2001. And it's all but impossible to find online, or at least it was whenever I was assembling my kits. And I didn't know that until one of my orders for it was canceled due to inability to fill the order. And that caused a delay in that particular kit being available to the public. And it ended up being a bookkeeping issue because, as I said, with this grant, you have to spend the money and then they refund it. So I had already spent it, gotten the refund from NLM, but then I also got a refund from IndieBound. And so then suddenly our bookkeeper has 2 refunds and is trying to figure out how to process it. So think about those things and more. Be very, very, very meticulous. If you make several of the kits, you're going to have lots of materials coming in at different times, and it does get difficult to keep track of everything. So I recommend keeping an Excel file with your projected costs and any updates to reflect the actual costs and any other pertinent information. So you can see here, I've got this one sort of broken down into personnel, equipment, and supplies. You can't see, but I do have extra columns where I track a narrative description of each item and invoice numbers and which line in our budget they're coded to help with the refunding. So this helped me keep track of the money I was spending, any items that arrived damaged, any items that needed to be returned or refunded, and which line items in the budget all of them were coded to. As for like the physical aspect of putting them together, this is exactly what we used. You know, we wanted to package them up so that anywhere between 1 and 10 people could take them, so they each get their own bag. Each bag contains the 2 books and the materials I told you about before. We opted for a zip closure because of book returns. I highly recommend that feature so that there's not books going everywhere. We got file folders and cardstock to protect the printed materials inside the bag, just to keep everything looking nice and new and not like you're getting it after someone else has already rifled through the papers. We also got these graphic medicine labels that you see on the left to identify the books as library books, because we actually cataloged the bag, not the books. So the bag is the thing with the RFID tag. It's the thing with the barcode. The books have no identification on them that they're library books. So we needed to put something so people wouldn't just assume they were part of their own collection. So that's where those graphic medicine stickers came in. And then label protectors to hold the barcodes and the graphic medicine labels on the books. And here's what a kit looks like. This is our mental health kit. So on the far left, you can see it all packaged up, ready to go to somebody. In the middle there is it unpackaged. So you see the 2 books and then the packet of materials starting with those discussion questions. And then on the right, this is the actual barcode for the bag, which tells everyone exactly what's inside and allows them to check it out and lets them know to bring it back to the desk. Because unlike returning just a book, we have to sort of like go through these whenever they come back and make sure that we refill it for the next person. So this is what they look like if you search for them on our website. They are part of the catalog. Every kit, regardless of theme, has the same summary. The only difference for each of them is the last sentence, which talks about which books are included. And then here it is in the ILS. I had our catalogers to go into the MARC record and add graphic medicine, graphic novel, the theme, and the authors and illustrators so that any of those could be searched in the catalog and it would bring these up. So once we got our bags assembled, we did a huge launch to celebrate having them done and sort of send them out into the world. We invited Rachel Lindsay to come and talk about the process of creating a comic and reliving her trauma through writing her graphic memoir, RX, which is in our mental health kit, and what her life has been like post-publication. She had a lot of really interesting things to tell us about what it feels like to have to meticulously analyze every single moment of a traumatic event that you've been through so that you can get it down on the page and make sure that you are conveying it appropriately. And then what it feels like whenever this very personal and private thing of yours is released into the world for everyone to read. We also did a book group test run. One of our established book groups read the mental health kit, and Rachel's talk occurred just a few hours before they were scheduled to discuss the kit. So it was really cool that they got to hear her talk and then meet later to talk about their experience with the books and what they had witnessed at her presentation. And we had a medical librarian attend their book group meeting that night so that if they did have any more medical related questions, they would have someone on hand who could answer those. In addition to that big push, we promoted the kits in book group newsletters and in various community organizations. One of the things that happened is the medical librarian who sat in on the book group, she actually, when I told her about the event, emailed it to a listserv of other medical librarians in Connecticut. And most of our audience for Rachel's presentation was actually medical librarians, not Darien library patrons, which was really interesting. And we also reached out to practitioners in town, doctors' offices, dentists, therapists, and several specific book groups. None of the practitioners ever got back to us. The book groups didn't necessarily follow up, even though they expressed interest. So that brings us to the challenges. Putting them all together is the easy part. Getting them into people's hands is the hard part. you may have a different experience. I think maybe if you are building this into a course because you have a built-in audience there, you're not relying on people to find out about it and come just because they're personally interested, which is nice. Also, like I said, I didn't have a place to display them appropriately whenever all was said and done because of the way we had to package them. So I included this picture. I was so excited that one of my colleagues was getting rid of this shelf that originally was meant to hold audiobooks on CD. And she asked if I wanted it for the graphic medicine kids. I said, absolutely. And within 3 hours of putting it out here where people could see them, the anxiety and depression kit circulated. And then within about 3 days, we closed for COVID. And then, of course, over the last year, I wasn't able to circulate them even after the library reopened because of COVID. So that was sort of a challenge. That was unexpected, but everything was challenging then. So getting them into people's hands and getting those conversations started, in my experience, was the hardest. Additional challenges were the lack of follow-up from interested parties and on surveys. I even went to the book group with physical copies of the survey and asked them to just fill it out physically, and I would take it and put it in online. And even then, most of them were like, oh, but I have so much to say. I really want to take it home and do it. And of course, I knew that that was never going to happen because how many of us get the receipt survey request at stores and you're like, you were awesome. I'll definitely fill out this survey for you. And then you never do. So I knew that I was never going to see those surveys again. You're fighting the stigma surrounding the topics as well as the graphic novel format in our case. If you are working with an audience who are graphic novel readers already, you won't have to fight against people who don't want to read comics. But you may have some of that stigma about the topics kind of hanging around. And then it is very time intensive. So between reading all of them, writing the meaningful discussion questions, ordering everything, assembling them, promoting them, and then maintaining the bags, making sure that they find their way back to you every time so you can refill them. It is very time intensive, but all of these challenges are worth it because, as I'll remind you, these are the benefits of a project like this. You are getting reliable health information out to your audience. You're starting those conversations. You're helping them build empathy, exposing them to new things. I obviously, like I said, I don't have a medical library background. I haven't been in academic libraries in a very long time. But one of the cool things that I did hear about at an academic library was they were using kits like this in courses for students who were becoming doctors as a way to talk about bedside manner and empathy, which I thought was really cool. And I think there's an article about it that you can find if you're interested. So that is all I have for the presentation. My email address is here. You can find me on the Graphic Medicine website liaison program page. I'm on Twitter. Please feel free to reach out to me if you have, if you're interested in doing a project like this, if you want to see discussion questions. Part of the thing for the grant is that I made this as a project that can be replicated anywhere. So I'm not precious with my materials. I will share everything with you. I'll send you everything. Let me know. Or if you want to brainstorm a way that you can incorporate it outside of a public library setting, I'm happy to help. And then if anyone has questions right now, I'm happy to take those too.
Thank you so much. There's no questions in the chat right now. But does anyone have a question they like? Oh, here's one. What is your Twitter handle?
I am typing it in now.
Perfect.
You're welcome.
I have a question for regarding the the discussion questions,
Yeah.
you said that they take a lot of time to create. So do you know of any open source place for discussion questions that go along with the books, or would you said you'd be willing to share, but
Yeah, so I'll tell you, I got some of mine from the New England region kits themselves. My friend Matthew No, who many of you might know, he's also a UK alum. He had written the questions for their kits, and so they sent me some of those. Some of our kits are the same themes as theirs, and some of them are different. So I used some of those questions. I also took full advantage of library resources to find places that had discussion questions ready made. So like some of the publishers have discussion questions that go with their books. For instance, in our childhood trauma kit is the book Hey Kiddo. And that was like an acclaimed book that year. Everyone was reading it. It was being built into curriculums and everything. And so the publisher had questions for that kit, and check the copyright, make sure that it's, able to be used in the way that you want to use it. So you can do that. And then, like I said, I'm happy to share the ones that we wrote as well. I'm not guaranteeing that they are the greatest questions, because, it's hard to write discussion questions about a topic that you're like, if it's totally unfamiliar to you, if you reading the book is the first time you're being exposed to it. But we all did our best to do a lot of research to make sure that we were, being deliberate in the questions that we were answering and not, harmful or anything like that.
Hi, Brittany. This is Rick, and I'm at the UK Medical Center Library. I just wanted to share with you that Matthew was here with us. He was one of our library interns back in the day
Yeah.
in the program here. So, and that was my, and I think a lot of my staff's first familiarity with the graphic novels, because he really had an interest in that, and I learned a great deal from him then, and I enjoyed your presentation as well to learn more. So I followed him and we stay in touch, and so he's done great work in this area, I think.
Yeah, he was actually, the way I found out about graphic medicine was, so in 2017, when I came here, I became the lead purchaser for the graphic novels. And then whenever we saw that strategic goal was health and wellness, I knew what Matthew was doing because I, followed him on social media, and I just thought that is so cool. I have to do that here. So he actually was the reason that I found out about it too.
Yeah, he's been a real leader, I think, in this area.
Absolutely. He's amazing.
I'm just curious, so what is I don't know how, I know we talked earlier, but how far along are you in the COVID? Is your library opened up enough that you can actually circulate these now?
Yes. So they still aren't out on the floor because we had to do a lot of furniture rearranging to sort of like allow people to distance. As of this coming Monday, we're no longer requiring masks in the building for vaccinated people. And so some of our furniture needs are changing. And I'm looking forward to being able to potentially bring that stand back out and get them back out into the hands of people. Right now, the only way I'm able to put them out is on displays, and they take up a lot of display space. So I'm trying to not sort of hijack everyone's displays very frequently, but I can't wait to get them back out. I'm also exploring the idea of potentially opening them up to other public libraries or just anybody in the state, and seeing if I can, budget for the ability to mail them to other libraries and have them and pay for return postage. That way other people can use them.
How did you go about finding all the texts, like all the books for the different kits?
So I really heavily utilized that database that I showed you guys from Alice Jaggers. And actually, let me go back to that slide and see if I can open up that database and show it to you all because it is so useful.
The link
Okay.
to that database is in the chat.
Oh, perfect. So yeah, if you go over there and like, it really is extensive. So you can search through by publication date if you know that you want something that is newer, which for some topics could be really important. You can search by health concern or social issue, by age group. I think some of these get submitted by librarians and other readers. And so you may find that not every column has something in it. If somebody, for instance, didn't really know what age group something would be appropriate for, they may not have filled it out. But it's very, very helpful to look through here at first and see what is represented, how many books are on that topic. I can tell you that in the world of graphic medicine, the two most represented topics seem to be cancer and mental health. So if you really want to do just one or two kits and those topics match with your community needs, you won't have any problem at all finding plenty of books for those. I feel like I'm noticing more people taking a notice to graphic medicine now, and a lot of publishers starting to focus in on publishing graphic medicine intentionally. So I think that we're going to start to see a lot more representation in the field. But for what's out there right now, I highly recommend looking at this database and using it.
Thank you. There's a question in the chat. Have you been able to recruit library students to assist with your grants or projects? And how could a student potentially assist you?
That's a great question. We haven't recruited library students to assist. The closest library school to us is a bit of a commute, so it's kind of hard to get anybody locally who could come in physically and help. But I'm trying to think if there's like any sort of online help that students could do. I think it would be great to have students do some of the marketing and promotion, just reaching out to organizations and, freeing up us to do other things and them sort of making that first contact. I think that would be a great student project that could be done from afar. If you have students that can come to you, assembling the kits, making sure that every kit has exactly the paperwork that it needs, making sure for us, the initial protectors that we bought to go around the barcodes, they just kept popping off. And so we had a very large project of peeling those off and replacing them with regular book tape. That would be something that anybody could do as long as it's not me, because that was really tedious and terrible. But there are any number of things. I don't know if I would turn over writing the discussion questions to a student, but I think any other aspect of creating the kits could easily be helped by a student. You're welcome. Also, if you, along with that, if you are doing a grant, recruit a student to help you with the grant writing process. That is super good experience for them to be able to have for whenever they go forward and they need to write grants. And it's also going to help you not have to shoulder the responsibility of that grant by yourself. It's very nice to be able to sort of delegate tasks in that process. So if you have someone who's interested, definitely involve them in that process. Thank you, Jeffrey.
Any other final questions or thoughts? Okay. Well, thank you again, Brittany, for taking your time and presenting this project to us. It was really great and informative. And yeah, thank you again for your time.
Thank you for having me, and thank you everyone for tuning in and asking great questions. And I hope you have a wonderful rest of your conference and a great weekend.
Thank you. You too. Bye. Bye.
Okay, so it looks like our agenda, we were going to have a break until 2:05, and then we will have our second presentation. So I guess you'll have a little bit of extra time, about 15 minutes. So, all right, we'll see you back at 2:05.
To research state legislation. And while most of the action in the news is focused on the actions or really the lack thereof of the US Congress, state legislatures are increasingly deciding the issues that affect citizens most directly. Just some medical examples here. States are tackling prescription drug costs. You can see that 62 bills were introduced in 33 states this year to cap the costs of specific drugs like insulin or to provide for cost sharing. 24 bills were introduced in 19 states related to drug importation programs. So while Congress is not acting on some of these things right now, the states are increasingly passing legislation related to healthcare. And just the sheer number of bills, you can see that in the last 2-year session of Congress, they passed 344 laws. Halfway through this year, they've passed a whopping 26. And in 2019, state legislatures passed over 18,000 bills. And so researching state legislation is somewhat similar to researching federal legislation if you've ever done that. But the major difference is instead of going to one site like congress.gov to do your research, you would maybe have to go to 50 state legislative websites. And they all provide different levels of information. And the ease at which you're able to find it varies greatly. And also there's sadly just not as much media attention on the actions of state legislatures, even though their decisions greatly impact the citizens. You know, in a lot of state capitals, there may be, you know, one major newspaper has a reporter and maybe the Associated Press, but that's it. And state legislatures themselves vary greatly and not just based on architecture like you see here. The size ranges from just 49 senators in the unicameral Nebraska legislature to 424 in New Hampshire. Some legislators are full-time, 10 are full-time. I have a kitten making an appearance. They have larger staff and higher pay. The rest of the states are part-time legislatures. And 4 states, including Texas, meet only every other year. And the number of professional staff in legislatures also varies a lot. You can see these numbers are from 2015, but they range from 2,100 in California to just 92 in Vermont. So you can imagine or not be surprised by the fact that each legislature's website is different and provides different levels of information, and it may be harder or easier to find it. And just in general, doing state legislative research can be harder than you expect it to, especially since all of the information is theoretically publicly available. I'm not going to talk about any paid subscription sites today, but just wanted to note that there are several, including StateNet, that are good databases of state legislation. And you know, really what I want to focus on today is that you really need to think like a detective when you're trying to do state legislative research, because it's not going to be straightforward. A lot of times you don't have key information like the bill number, and you need to first figure out where you're going to find that. You might have the bill number and be able to find it on a state legislative website, and it won't give you enough information. You'll have the text, but you won't really know exactly what the bill does or why it's been proposed or what it's trying to solve. So one great strategy when you are faced with a situation like that is to identify the stakeholders. So who are the people that care the most about the bill? Because they might be able to provide better summaries or more information. And so one of the first things you need to do when you're doing this kind of research is to figure out what it is that you have. You know, if you don't have the bill number, that's probably the first thing you need to find. But like I said, even with that, you may not have, even after you find the bill, it might not have enough information. So I'm just going to go to, lost my mouse. Well, I'm going to go to the Kentucky website. And if you, for example, heard that Kentucky passed a law this year that capped the price of insulin, the copay, and you wanted to find the text of this bill, and you're a regular person who doesn't do this kind of research professionally, you're on this page, and I'm kind of thinking, well, I'm going to go to bills, and then you are going to pick the right session. And then you're faced with this crazy page. And there's nowhere obvious to like search for a keyword. I mean, it's not really clear where to go from here at all, but you know that it became law. So I'm going to click on this law button. So this is not helpful at all. I mean, you'd have to click on each one of these links to figure out, to find the bill that you're looking for. So that is not going to help you. So at this point, I'm thinking, I really just need the bill number before I can do anything on the Kentucky website. And I mean, really, I just do a Google search for insulin, Kentucky legislature. I'm trying to find a news article or something that mentions the bill number. And so the very first thing here we have is a news article, which is great because a lot of times it will mention the bill number. And if you scroll down here, you can see that it is House Bill 95. So, okay, now I at least have the bill number. I can go back to where we were before and go to 95. And on this page, you can see like that it was signed by the governor and the sponsors. And here's a summary of the original version, which is, 2 phrases long. And I can click on the bill text here. And this is a pretty easy bill to read in that the new things are in this bold and italics, and the stuff that is being deleted is being crossed off. And you can see here that, cost sharing for insulin shall not exceed $30 for 30 days. But then there's some other things about governmental plans and, I'm just not really sure what these other clauses mean. And there's not a good summary here on this website. And so that's often the case. Some state legislatures are really good about a plain English summary. Kentucky is not. And so again, you're going to go, you want to, I didn't mean to close it, but let's see if I can get that bill again. But this article has a pretty good description of the bill, what it does, who it applies to, and it also mentions that who supported the bill, that the American Diabetes Association did, not surprisingly, and some other facts. So, this news article gives way more information about what the bill does than the legislative webpage. And just another example of how you need to go beyond the website is like, here's just another bill related to mental health. It is much harder to read because there's a lot more crossed off and more added. And, it's just, you'd have to be a lawyer to be able to go and understand what sections are being changed. And there's really no good summary. But just doing a Google search allowed me to find an article in the news about this mental health bill with really good summaries and hearing from the sponsor about why it was introduced. And also when I talked about stakeholders, I was talking about other groups that are for or against such a bill. And so I found information on the Kentucky Voices for Health, talking about this bill and what it does. And I always love when you see, what does this really mean? Because I know it's going to be followed by a plain English summary. Same thing, like I checked the Kentucky Medical Association, and they have information on this bill in their, what they call their action center, which is where they are getting, encouraging their members to write to their legislatures, either in support or in opposition to a bill. So this is all a useful place to find the context and the background about what a bill actually does. And just to contrast this, contrast Kentucky with another state, I just want to show you, this is the homepage for Michigan. And from here, if I type in insulin, you can see that I get directly to this bill pretty easily. And they are very clear in their summaries about whether it refers to the introduced bill or to the bill that's been amended. And it has a really good plain English summary. And also what I like is it does tell you what groups were in favor or opposed to the bill. So I could go to each of these websites and see if they had more information about what this bill does, or why it was proposed, what solution it's trying, what problem it's trying to solve. And so, really when you're looking for context or more information on a bill, like the gold standard is a plain English summary that tells you what the bill does. And so some legislatures are really, really good at that. Like here's an example of Arizona, which is one of the best legislative websites, but like the history, like what this is changing, what each of the provisions does. This is just, this is like the gold standard of a plain English summary. So in addition to the plain English summary, I'm always kind of looking for a news article that explains what the bill does in simple terms. If you can find a press release from the sponsor, they always want to tout their bills. They will give you good information about what the bill does and why they're sponsoring it. And again, you can also look for press releases from organizations that support or oppose the bill that will give you more context and kind of more background information on the bill. And I briefly wanted to talk about alternatives to searching on a state legislative website, because you might want to use one of these sites, either because you're searching a state like Kentucky that doesn't make it easy to search, or you are searching multiple states. And so there are 3 different ones here. They're all very similar. They're just slightly different in how they display the information. But what they do is they use APIs to kind of just download all of the legislative information from the legislative websites, and they make it easier to search. So just to show you one of these. So BillTrack is one of the newer ones, and it's currently kind of my favorite. You do need to register for it, and you get a login, but it's free. So don't let that dissuade you. But you can search either one state, like so you could just search Kentucky, and you can search a keyword search for this, and you can see that these were the bills, and here's the one that was signed by the governor. Like this was so much faster to find the bill than trying to start on the Kentucky legislative website. To be honest, if I'm searching for a bill in Kentucky, I might start here rather than try to move around that site. And you can export this list. I'll show you what happens, because you can also do this for all states. And we'll add in copay. and you'll get longer lists. And so you can filter this. You can download this to Excel to manipulate later. I will say that I realized that you get different results if you search with or without the hyphen in copay. So something to remember. But it's just really useful if you're trying to figure out, like if you had a question about the number of states that have set copays, limited copays for insulin, these sites that aggregate are an easy way to do that. And I realized I wasn't completely 100% fair to Kentucky, because if you play around on this crazy page of all of the links, and I realized this by accident, you would think that this was all one link, and it's not. It's two different links. And if you click on the one with title, you at least get a little bit of information. And so I could have searched for insulin, and fortunately it was in this very brief description, but for the most part, these are so general and broad that it would be hard to do searches this way. And there is another kind of hidden way to do this with this bill and amendment index headings. I mean, isn't that where you would start if you were looking for a keyword search? So this, you know, you're here and it's like, okay, is it under insulin? No. Is it under diabetes? No. Is it under drugs? Maybe it's under diseases. But now when you search for insulin, you do find the bill. So Kentucky does have the capability to do this, but they just make it so hard to find, and you would never think to go to bill and amendment index headings. When you compare this to Michigan that just had the plain, the search bar on the main page. But just the very last thing I wanted to talk about, I know I'm running out of time, was, you know, if you're doing searches for across multiple states, there's maybe no need to reinvent the wheel if someone else has already done it. And I just wanted to give a plug to the National Conference of State Legislatures. They have a 50-state searchable bill tracking database with a gazillion topics. This is all powered by StateNet, the database I talked about earlier. And if you go to prescription drugs, for example, you have all of these different subheadings that are very specific. And so if you search for cost sharing and deductibles, you get a list of the bills from this year on that topic. And you could even add a keyword for insulin to narrow this down further. And so now you have a very targeted list of states' bills this year about insulin price caps. So if you don't have access to StateNet, you can always, if it's a topic that's covered in this NCSL database, you can definitely do the searches there. And finally, I want to just say there's other state organizations that do this kind of work. And one of them is the National Academy for State Health Policy, which is a nonpartisan group of state policymakers. And they have lots of charts and graphs about different state policies. This is where I found the information on the number of bills related to drug importation and cost sharing. So someone's already done the work here. So you don't need to do it again. So that was a very, very quick introduction to why you need to think like a detective when you're doing state legislative research, especially if you're searching in Kentucky, whose website is not that great. But I'd be happy to take any questions. I know I'm about out of time, but if anyone has any, I am happy to answer.
Jennifer, I don't see any in the chat. I particularly find this information helpful because I have some of my nursing classes, they do law and legal research about a health-related bill, and they always can't find the information. And so this was extremely helpful for me.
Well, I'm glad. It is, Kentucky makes it particularly difficult to find information. And so knowing that there are other options out there that let you search Kentucky with a better interface is sometimes half the battle.
Yes, it was good to see that. And actually, we do have a question. So
Yeah,
have you,
I see it.
okay,
Yeah, you can, if it's a bill that is in the news, a Google News search can be handy. The problem is so many of these don't make the news just because there's so little coverage of state legislatures. Some of the free sites that I mentioned do have the ability to do saved searches or to be notified, although some of them might make you pay for that extra functionality. But if you're tracking a bill, sometimes those sites will let you do it. I think Open States does it for free. They don't have any paid part of it. I think you can set up alerts there that notify you when a bill is moving. So those are some good options in addition to a Google alert.
all right. Well, thank you, Jennifer. We appreciate your time and expertise.
Well, thank you. I hope you guys enjoy the rest of your afternoon's presentations.
Thank you. So we're going to go ahead and just move on into our the next set of lightning talks and posters. I'm going to go ahead and ask, again, we're going to ask you to just hold your questions until the end of the round of lightning talks and poster, and then we'll have a chance for questions at the very end. And then I'll introduce each lightning talk and poster one at a time. So the first one, if Annabelle and Carly, if you want to go ahead and get your presentation up as I introduce you. Our lightning talk number 3 is the preliminary collection assessment on epidemics, alternative spring break project at the National Library of Medicine. And it's going to be presented by Annabelle Smith and Carly Jessup from the University of Kentucky School of Information Science.
Can everybody see my screen share?
Yes.
Okay, great.
All right, so I'll go ahead and start us off. So we're here to talk about our preliminary collection assessment on epidemics. And this was our alternative spring break project at the National Library of Medicine.
Oops, here we go.
All right, so my name is Carly Jessup. This fall, I'll be starting my second year as an MLIS student at the University of Kentucky. I'm a graduate assistant for UK Libraries in the Departments of Information, Literacy, and Reference. Additionally, I work part-time as an adult services clerk at the Johnson City Public Library. I've been working remotely from Tennessee from the past year due to COVID, but I will be moving to Lexington in August for the second year of my graduate assistantship.
Hi, everyone. My name is Annabelle Smith, and for those of you who know me, my voice doesn't always sound like this, but I'm feeling a little bit under the weather, so I might mute myself if I need to clear my throat. So I wanted to thank you for your patience in advance. This fall, I'll be starting my second year as an MLIS student at the University of Kentucky. Prior to starting this program at UK, I worked at both the Lexington Public Library and the Jessamine County Public Library. Currently, I'm a graduate intern with the College of Agriculture, Food, and Environment Liaison for UK Libraries. And this fall, I will be a graduate assistant for the Medical Center Library at UK.
Each year, the University of Kentucky offers MLIS students the opportunity to apply for alternative spring break experiences at a variety of libraries, including the National Library of Medicine. The past 2 years have been a bit different due to COVID, making the program virtual instead of in person. Additionally, spring break was canceled at UK, also due to COVID, so our week-long internship took place in the summer. The National Library of Medicine, pictured on this slide, is located in Bethesda, Maryland, and is actually the largest medical library in the world. We had the pleasure of working with Judith Iannarino on this project, who is the head of collection development and acquisitions at NLM. In addition to our project, we had the opportunity to attend virtual information sessions regarding a variety of topics, including outreach and engagement, metadata, digital humanities, and more. Our project was a preliminary collection assessment on epidemics. This was a timely subject matter considering the ongoing pandemic, which made our research both rewarding and fascinating. Our research included examining a bibliography of epidemic-related titles, determining whether or not NLM held these titles in their collection, using Locator Plus pictured in the bottom right corner, and making recommendations as to whether the titles not held would be valuable additions to their collection.
In this slide, we have an example of a title that we researched and reviewed whether it will be useful to the National Library of Medicine's collection. After researching, I discovered this title that the National Library of Medicine holds many titles authored by Paul Farmer, who is chair of the Department of Global Health and Social Medicine at Harvard Medical School. Farmer has also written extensively on health and human rights, global health, and the role of social inequalities in the distribution of infectious diseases. And in this book, I found out that Farmer explores the Ebola outbreak in West Africa, why it happened, and what we can learn from it. Farmer had firsthand experience during the Ebola outbreak because he founded the organization Partners in Health that was among the international responders to the outbreak. Although this is considered a popular title, I recommended that the NLM consider this for their collection because it comes from a renowned voice on global health and human rights who has hands-on experience with one of the most well-known epidemics in recent history. And finally, there were several reasons why we did not recommend some titles that we reviewed. Examples include the title having too little of a focus on the topic at hand, such as, for example, a book with maybe only one essay discussing an epidemic or one chapter. Another issue was author credibility, or perhaps it was a reprint of a title already owned by NLM. Or there could be another title in NLM's collection that's potentially a better resource on the topic. So those were some of the reasons that we perhaps considered some other options for the materials that we reviewed. And for a quick overview of this project, we searched 123 titles in NLM's collection using Locator Plus. After searching, we discovered that the National Library of Medicine held 110 of those titles. And of the remaining 13 titles, 4 titles were recommended for consideration. But the remaining titles were not recommended or referred to the appropriate liaisons who could further analyze the titles as needed. So this is just a brief overview of our project and some of the work that the National Library of Medicine is doing to assess their collections on relevant health topics. So overall, it was a fantastic opportunity to get to learn and get involved in collection development as students at UK. And that's all I have. So thank you all for listening.
Thank you, Annabelle and Carly. Again, we'll wait and have questions at the end. Our next lightning talk is going to be learning the MLA competencies through a practicum experience, a student's perspective. And this is going to be by Kayla Robinson with University of Kentucky Medical Center Library.
Hello, everyone. You know what? I'll leave them. Okay. Hopefully you all can see the subtitles, so that'll be nice. Hi, my name is Kayla Robinson. I recently graduated from the University of Kentucky Library Science program. And then I was also recently hired as a new health sciences librarian at the University of Kentucky's Medical Center Library. So I'm really excited to start very soon in my new career. But today I'm going to be talking a little bit about my practicum experience that I conducted while I was still a student, which was 2 months ago, just about. So first, I want to talk about where I was. I have a mentor at the University of Cincinnati, not Kornhauser, that's at Louisville, Donaldson Health Sciences Library, where I met one of the health sciences librarians, Emily Keene, when I was still in undergrad, and she mentored me throughout my entire career and is part of the reason why I'm a health sciences librarian. I worked with her before I was in library school as well. After I had completed 3 semesters and was about to graduate, I wanted to conduct a practicum experience. So I reached out to Emily and I asked if she had any projects she wanted to work on. And she invited me to work on a publication with her, as well as get involved with some instruction and instructional design projects that the Donaldson Library was hoping to conduct. The main part of my practicum, though, was that Emily wanted to prepare me for the workforce, essentially. She wanted me to be the best candidate that I could possibly be while I was job hunting. So the focus was the MLA competencies, the professional competencies. Oop. Okay, so there are 6 professional competencies. Those are information, instruction and instructional design, leadership management, evidence-based practice and research, and health information professionalism. Now, obviously, I was only going to be able to be with her for about 3-ish months over the course of my last semester. So we focused primarily on 2 of these professional competencies that I wasn't learning about at my graduate assistantship at the Medical Center Library. Those being instruction and instructional design and evidence-based practice and research. We focused on those mainly because those related to the 2 projects that I previously discussed. So for the first project and the most important one, the research project, we took about 163 integrative reviews and we analyzed them individually and then came together and saw where there were gaps in kind of the methodology of evaluating them. So that took about 110 of my 140 hours that I had to conduct with my practicum. So day and night, I would be reading articles and analyzing them and seeing how they fit the mold and how to analyze those as a librarian and pulling statistics from that. We're still working on the publication now, but eventually we're hoping to have one out in the next couple of years. Once that was done, we moved into the second portion of my practicum, which was the instruction and instructional design, where I was able to not only interview librarians at the Donaldson Library, but also ask about their personal experiences as health sciences librarians and how they see the future of instruction. So I focused heavily on those 2 things. But one of the not specified benefits of working with Emily was that I also got to practice my health information professionalism, which focuses heavily on collaborating with your fellow librarians and producing research and contributing to the body of knowledge that is our field. So I had quite a few benefits from working with her. And it paid off because now I do have a job, which is very exciting. And I'm very thankful for that practicum experience. And as with my time about to begin as a full-time faculty librarian at UK, I cannot wait to continue to work with students and start helping them have the same experiences and the same breadth of knowledge that I gained at my practicum, at school, and at my graduate assistantship. Thank you.
Thank you, Kayla. Our next poster presentation is going to be making connections when citing tables and figures. This will be presented by Marilla Antunes, the Life and Health Sciences Librarian at the University of Akron, and Jeff Franks, the reference.
I can introduce myself. It froze up.
It looks like Stephanie has frozen, so.
She has frozen. So yeah, someone was going to display the poster.
Oops. Let me
I guess I just did it. I don't
Okay.
know, okay. All right. Can everybody see that?
Yes.
Okay, so Marilia is the Health and Allied Science or Nursing and Allied Health Sciences librarian. I am currently reference and instruction librarian with my main assignment being to the College of Business. However, I've had a great deal of experience prior at Michigan State University with serving medical students, veterinary medical students, and all the allied health students, and then a little bit of that at Central Florida too. So this poster session is about the planning and development of self-paced tutorial within the Brightspace learning management system. We developed the tutorial with the goal of encouraging the utilization and referencing of tables and figures in assignments and papers because people are hesitant to do that. It's a little more complicated. Also, to encourage faculty and others to add their Creative Commons mark on their own creations. And finally, to highlight some benefits of utilizing open educational resources. A little bit of background: the creation of this and 4 other tutorials has been a collaborative effort of about 6 librarians, and we've all contributed different things to the different tutorials. The first couple of tutorials were very basic library instruction, information literacy type tutorials. They were primarily motivated by the COVID pandemic, as we suddenly found ourselves conducting all of our instruction remotely. We felt we needed something more than just our numerous live guides, and boy, we have numerous live guides, and something more than just our virtual sessions, using Zoom and Teams and WebEx and so forth. So we set about creating these tutorials in Brightspace. We have also seen a great deal of librarian attrition during the last 5 years or so, and we actually lost 4 library faculty, 4 library subject librarians exactly 1 year ago. So we're all doing a whole lot more with less. Finally, this particular tutorial is based on the APA style 7th edition, and will meet a consistent demand that we've seen from nursing and allied health students for needing help with citing tables and figures. So it's in response to that, basically. And now I'm going to turn it over to Marilia.
Good afternoon, everyone. Good afternoon, everyone. Can everyone hear me? I just turned the volume up. Great. To add to Jeff's comment and how we started doing this, we decided to do a tutorial, and this tutorial in a way is a complement to another a broad APA style tutorial. And as many of you know, APA style is used mainly by the health sciences, especially nursing. And we started getting, as Jeff mentioned, questions that we typically do not get about how to cite copyrighted websites, images on copyrighted websites. And the 7th edition of APA delves more with this. And I thought it was going to be easier, but it's actually, it encompasses a lot of aspects. As we delve more and more into the tutorial and developing the tutorial, we realized that in a way we needed to provide refreshers on a couple of things. I'm not sure if we're able to enlarge the tutorial, if we're able to enlarge it, but I wanted to point out that we needed to provide a refresher because citing tables and figures involves having a basic comprehension of copyright and other type of copy licenses, especially Creative Commons and other licenses. We wanted to be as practical as possible, and it was very time consuming to identify common examples that would be practical for our students. And so this tutorial is unique, in my opinion, because we found through the process that we discuss and introduce in many cases open educational resources, not just open access, but also open education resources. We had to provide a refresher on copyright, Creative Commons, and very interestingly, not just what Creative Commons is about, but also we decided to capitalize on the tutorial and show the users how to create and empower them to create their own Creative Commons icon, so they can add it to the works that they create. Not just citing, but also to empower them with that information. So the tutorial consisted of 4 modules, and we call each module a lesson. And it was a combination of HTML slides similar to PowerPoints. We also provided quizzes, and we also provided some videos. And so this is not just something that is very typical. And we did this because we wanted to also encourage our target audience, which would be all users that for example, graduate students who are likely to cite tables and figures for their thesis or dissertation, and even faculty, to inform them of, or remind them of that the open educational resources are available. To remind them that also that there are initiatives that the university participates on, and in the hopes that we encourage them to be more actively engaged in those open educational resources, while we are still discussing how to cite tables and figures. So that was one of the major goals. Because the tutorial was created using our LMS, we used E2L Brightspace. I'm happy to provide an example to anyone that's interested. Obviously, it requires a university password and ID, so it's not openly available. But if anyone has any questions about that, I'm happy to discuss that in detail. We learned a couple of things as we did this, especially in the development of the tutorial. We needed a target audience. So one of the things that would be very, very useful, as mentioned on the poster, is to identify key assignments that involve that are very likely to involve tables or figures. And of course, immediately we thought about the graduate school and the formatting for thesis and dissertations. So that's an excellent audience to target as a starting point. And also surveying the graduate students on what challenges they face when doing this. And also testing the learning tool, the tutorial with the student workers that we have here in the library. We thought that would be a valuable source that we can tap into to get feedback from them regarding the usability issues, because we're using Brightspace, so it's not quite the same as using a LibGuide, for example. So those are some of the recommendations that we did in the development of a tutorial. It was very interesting and very, I learned a lot. So I can tell you, I've read this book quite a lot. So it's the APA manual. It's ingrained now. So it's not something that we typically cite, but it took a lot of effort, and it took us many months to work on this. So we're very happy that we're seeing more and more questions for this type of citation. And I would feel more confident that this will be a valuable source.
So we're probably out of time, or almost out of time, I'm guessing. So I'm just going to wrap up by saying that we will launch this in the fall, and we're still working on a method, an instrument to evaluate all of our Brightspace tutorials, and hopefully several of us can turn that into an article for publication eventually. So it's been fun. It's been necessary, so it was worth the effort. And I guess if you have questions about the poster, you could email Marilia or me.
Oh, so sorry. Thank you so much to everyone in this section. We really appreciate you all presenting your projects to us. So we have a few more minutes for questions, about 4 or so minutes. So if anyone has any questions, please feel free to just ask them or put them into the chat, and I will read them if they're in the chat.
I have a question for Kayla. I I think that having a mentor, like especially during while you're still in school, is like really good. And I was wondering how you went about that, how you established that relationship in Cincinnati with that librarian.
Yeah, so I'll give you the quick version because I've known her for almost 7 years at this point. But I think the best way to go about that is to just ask. Part of the reason why I wanted to become a librarian when I was about 19 was because everyone I talked to was just so helpful and really wanted to kind of contribute to my overall education. So if there's a health sciences library you're interested in working at, or a health sciences library, or any kind of library that you want to work at, it's just reach out. Practicums, I thought at first a few years ago that people like posted them and then you picked one. That wasn't the case when I found mine. I just reached out to someone I already knew. So begin making those professional connections by sending an email or giving a call and saying, hey, I'm a student. I'm looking for a project to work on or something to do here. If you all have the staff to help me out, and then seek out mentors that way. I would highly recommend. I have many now, and I definitely wouldn't be where I am without them. So if you're interested, please go find one. Everyone is always so helpful.
Great, thank you.
And it looks like the other question was answered in the chat. Thank you, Marilla. Any other questions? Okay. Well, we can gain 2 minutes. Oh, no, Rick has one.
No, this is Rick from the Med Center Library. I just wanted to thank the presenters. That was really all good information. And Annabelle and Carly, I wish you all could have had the opportunity to have gone to NLN to sing their facility. That would have been really awesome. Had it not been for the pandemic, you would have been there. So maybe someday you will get there. And Kayla, great presentation. Enjoyed that. Good information. And to Marilia, did you used to be at Appalachians? Yeah, I remember you from years ago when we were doing the Radiological Society conference in Chicago. I believe you were one of the people at the booth with me. And so it's been a while, but it's good to see you again. And thank you for your presentation, and Jeffrey as well.
Yes. Thank you, everyone. We really do appreciate it. Okay, so we're gonna take a break. We'll be back at 3 o'clock. And it looks like Stephanie's internet is still out, so I will do the next introduction. So thanks, and I'll see y'all in about 5 minutes.
Yes, I am. 1 minute.
Take your time.
Oh, I'm sorry. I have a new laptop as of last week, so I have to leave the meeting and come back to allow it to open, so.
Okay, sounds good.
Okay, here we go. Is it visible now?
It is, it is. So, okay, I'll just go on and introduce you and then hand it over to you. So next is Ansley Stewart. She's a clinical librarian at the University of Louisville Kornhauser Health Science Library. She's going to be presenting to us today, Preserving Through Publish or Perish. So I'll hand it on over to Ansley.
Hi, thanks. Yes, so my name is Ansley Stewart. I'm going to leave my camera off because I am recovering from a bad head cold. So sorry if you hear me coughing throughout this. My presentation is largely what I present to our incoming residents for internal medicine. They are required to publish by the end of their residency after 2 years. And so I work with their research impact group. And I'm kind of taking you through the presentation that I give to them both in the first week of August as they're coming in. And then we kind of repeat this again in January because we realize that they've had a lot of information thrown at them as soon as they're coming in as residents. So I kind of try and break this down into SMART goals for them in terms of what their timeline should be. And even though they have technically 2 years to publish, I kind of give it to them in terms of what they should be accomplishing within a year. So I would like to break it down into 4-month sections for them. So I kind of tell them what to do within each trimester or those 4 months. So they do need to have something published by June of 2023 if they're coming into this year. And so I don't anticipate them starting really the first year by the end of 2021. And then I like to let them know, this is your complete process from start to finish. And here's largely where the libraries are going to be helping you, because there's a lot of kind of skipping over until you reach that step and you realize you should have started back a few months earlier than that. So right off the bat, they need to have their city certification completed, which their contemporaries are very good about letting them know about. Kind of give them time to generate ideas. So there's kind of an overlapping of deadlines with, you want to be looking as to who you want to include in your writing group, but also thinking about obviously what the subject is that you want to be writing about. Kind of decide your authorship agreement early, because I don't feel like that's talked about much. Pretty much determine your study format, which is flexible. You can end up changing that, and really just let them know that this is the time to be scheduling their project, especially if they want to make the impact easier on their principal investigator and their faculty advisors. So I just stop. I let them know city training first, because everyone kind of forgets about it. It's a pain, but it is what it is. And then I bring up the evidence-based pyramid with them, which hopefully at this point they have seen, but I tend to find that a lot of incoming residents have not encountered this before, which makes me a little sad. But we go over the various studies and types of research that are out there, because again, a lot of them are really new to this. They've been focusing so much on learning their specification, their subjects, but they haven't been learning so much about the research side of things. So now I let them know, I take them through and visually show them what are the different types of publications and studies that they can be doing. We kind of let them know where's better places to publish, like QI studies will always have a niche that needs to be filled. And here's kind of why I do a little plug for citation management programs and let them know how we do EndNote training, and kind of other little side quests they can be working on at this time. And also that there's nothing wrong with repetition. A lot of residents come in kind of wanting to do that really shiny new zebra kind of project of something that no one else has seen, but letting them know that really repetition is kind of the heart of building the evidence, right? So we do need those studies that further prove what we already know and to excuse me, to be reproducible studies so we can learn from them and solidify our current knowledge. So talking to your principal investigator, which is something they asked me to do, and I kind of leave a lot of text off these slides because this is kind of the point where I tell them this is a time where they want to go and gossip to their other residents and other fellows that are around their department and kind of figure out who is a good person to work with. It's not something they can do so much research on the internet on their own. It's more of a, find out who's actually going to help you, because there are definitely those faculty advisors who, it gets to be time where you're working on your IRB project and they're not signing off on it because they're so busy themselves. So this is a time to think who values align with your own, who is not so overwhelmingly busy, the head of the department, that they're not going to be able to help you, and decide who else you want to be on your writing team as well, if you do want to pair up with someone and be on your writing team. And it doesn't have to necessarily be another resident. It can also be someone who has a specialty in the field. Also consider outside sources like statisticians, if that's what your project needs, or librarians, again, giving more plugs to the library during this time. And go ahead and create your timeline with those people. And when you do find your PI, set hard meeting dates to meet with them, especially when you're doing the IRB process. Kind of what I was saying, discuss authorship. I feel like this is something people get to the end and they're saying, oh, I don't know who should be first author, where my name should be. And I realize it's kind of fading as a more old-fashioned idea of, first author, best author, most important. For their project, their PI would have to be pretty much the first author for wherever they're publishing, but kind of let them know what are their emerging trends. For instance, I've been seeing on when they're applying for fellowships and the like, on their CVs, people have been putting asterisks or notes saying that order of names within the authorship does not signify, who did the most work. It might just be alphabetical, or that all the authors did all this amount equally and it was shared. And I kind of think that's a good trend, to be honest. So once they've kind of got their idea done, moving into the second trimester of their project, starting on the IRB process, just give that plenty of time. Obviously, continue working on your project, being the actual meat of gathering the data for what they need for their project. Considering different publications, because they're not required to just aim for the top ranked journals. They're allowed to do publications by presenting at conferences and the like, which I appreciate their flexibility with that. And as far as the IRB process though, I let them know I have very little idea what's going on with that. They kind of expect me to know what is. I feel like unless you actually work in the IRB office, you don't really know what's going on with IRB. Unless your job is maybe you're either working in the IRB office or you're a research assistant whose main part of the job is working with IRB. I just let them know, basically, it's kind of you're gonna negotiate with them and give them whatever they want kind of situation. Plan on it taking at least a couple of months, because there's going to be at least one revision, them coming back to you and saying you need to change or add things. But they are very friendly and they will work easily with you, and to remind them that they're not working on hospital hours, they're working on university hours. So if they're trying to rush this and get this done over Christmas break, they're not going to have anyone in the office to be talking to them. So just kind of keep that in mind. Then everyone was working, residency hours. But yeah, revisions, just follow them, give them a call, give them an email, very friendly. And then you have pretty much unlimited options as to where you want to be submitting. It doesn't just have to be a journal. I like to make a plug here for local publications, such as U of L's Journal of Respiratory Infections, if that has to do with what their project is. We have that in our institutional repository. And then to also consider open access. And this is kind of my time to get on my soapbox a little and talk about open access and publishing within journals. I also like to, because I don't think many of them have looked at what journal expectations are when you are submitting for publication. So I pull out some screenshots this is for JAMA's if you're going to publish with them, that this is what they should be expecting based on what type of study that they're doing. So it lets them, again, break down kind of into SMART goals as to, it's going to be a max of 3,000 words. You're going to have this many figures. You're going to have to follow these guidelines based on this research. Whereas if they're trying to do a smaller project such as case study or case report, JAMA doesn't really accept case reports all that often. So it's something they're going to have to consider based on what their study is. They should think about what kind of study they want to be doing before where they want to be publishing it. It should be one following the other. And then I also get on my soapbox a bit about publishing as to this is a money-making process for the journals, especially if they're trying to do top-tier journals. So I don't know if any of you saw this tweet when it came out, but someone explaining academic publishing in a very in a different metaphor, which is cows make milk, they milk themselves. Other cows check the milk for free, aka peer review. Cows pay the farmer to take the milk away, and then the farmer sells the milk back to the cows. I think unless you're really a librarian, or again, you're specifically working on research all the time, publications all the time, you're kind of not realizing how often academic journals are profiting off of the labor of what residents and students and the like are doing. So I like to let them know that now is not the time to, just because they're doing something very last minute, doesn't mean pull out your wallet and pay someone to accept, to just look at your article in the hopes of making it having it be published. And that leads us into third trimester, which is kind of, you've pretty much done with your project. It's time to write the paper. If you're going to be publishing to a journal, you can usually write the paper and then the abstract for a submission. If you are hoping to do a conference presentation instead, you can kind of have the leeway of writing the abstract and then doing the paper, just depending on what you need. And then pretty much follow the journal or conference's guidelines from there. So just write it out. It's, take the time, sit down. Again, this is where you're planning ahead of blocking out your time and it's really easy if you're working within a group. A couple people, one person could be working on the methods section, one could be working on results. Excuse me. And writing the abstract is, I think, fairly easygoing because you pretty much just need to keep it to under 100 words. Make it look pretty, divide it into the 4 sections. I've seen more trends of people calling the introduction often the background or the objective now. And sometimes you have the option of keywords just depending on where you're going. Of course, see individual publishers for specifics. And one of the kind of fun things I think is consider what your authorship name is going to be. If you know that you're going to get married soon and your last name is going to change, or you're changing your name for another reason, know that once you start publishing, it's going to be kind of a pain to change your name when you're keeping track of bibliometrics later, if you want people to be following your work. So just keep that in mind as to what you want to be known as in databases and the like. And then aim for about 5 publishers, kind of 2 that are top tier, kind of a reach deal, 2 that are pretty much within your grasp, and then 1 that's pretty much a guaranteed acceptance. And give plenty of time to allow them to reach out to read through your application and get back to you. So this is early on in your third part of the trimester. And then follow up is following up. They'll get back to you. Unfortunately, if you get rejected, you can look elsewhere because you've got other options. I like to let them know that if you do get accepted with edits, you can make the edits or don't. They very much have that option of if they come back to them with edits and those edits don't sit right with them, particularly hearing lately about how people have been talking about racial biases in medicine. And peer reviews coming back to them and saying, well, maybe the word racism isn't the right word to use, and trying to water down their results or their conclusion, stand behind your work, be proud in it. If someone is trying to not be, is trying to water down your work, you don't have to publish there. That's perfectly all right. And then if you do get accepted and that's the one place you want to be published in, great, celebrate. And then when you have accepted that, do be sure to look over the contract from the publisher, because there are some that will say that will take your work and then not allow you to make sure that you don't have rights to your original material. Not all the time, just something to carefully read through, especially if your PI is the one who's having to sign off on it. Keep track of your bibliometrics moving forward. It's going to save you a headache. And do consider putting your work in the institutional repository wherever you are. For us at U of L, it's Think IR. And that is pretty much what I have. Like I said, I find this a very beneficial place to go ahead and plug through the libraries. And thankfully get to work closely with the residents and over the long haul process, and hopefully ease some of their suffering through this process. So any questions, please let me know.
Thank you, Ansley. We really appreciate it. See if there's any questions in the chat. I don't see any, just some thank yous. Anyone else have any questions they'd like to ask? Okay, well, I guess we can, it's only 2 minutes early. We can thank Ansley again for all of her work on this. And we can move into the panel.
Thank you.
Thank you.
Okay, I'm going to see if my internet is going to work. So this is the Career Paths panel, and our moderator today is Kayla Robinson. She's the Health Science Librarian at the University of Kentucky starting August 1st. And our panelists today are Melinda Robertson. She's the Assistant Director for Health Sciences and Medical Librarian at the University of Pikeville, Kentucky College of Osteopathic Medicine. We also have Amy Baltz, the Associate Professor and Librarian at Sullivan University, College of Allied Health and Nursing. And then Riley Sumner, who's the Hospital Librarian at the University of Louisville, Roundtree Medical Library. And finally, we have Billy Ann Gibb, the Director of Library Services for Frontier Nursing University. Welcome, everyone.
All right, thank you, Stephanie, for the introductions. So, hi, my name is Kayla. I'm going to be your moderator today, and I have quite a few questions, so hopefully we'll get through all of them, but if not, that's totally fine. And then we will be going until 3:50 today. So my first question is for all of the panelists, and because this is a career paths panel, I felt it was pertinent to kind of get some of your all's background and how you ended up at your current position. So if y'all could please let everyone know how you ended up working where you are and in the position that you're in.
I can hop in first. So my name is Riley Sumner. I am the hospital librarian at Roundtree Library, which is part of the University of Louisville Hospital. I went to the University of Kentucky for my library science degree. And there I worked as a graduate assistant at the Medical Center Library, and then also a graduate assistant at Archives and Special Collections. But really, I became more interested in working in a library of some sort when I was a student assistant at Kornhauser Health Sciences Library all throughout undergrad. So they kind of introduced me to what working in a library looks like and encouraged me to get my master's in library science. I have an undergrad degree in psych and sociology, but decided to go that library route. So.
I guess I can hop in next. I'm Melinda Robertson. I'm the Assistant Library Director for Health Sciences at the University of Pikeville, Kentucky College of Osteopathic Medicine. I went to UK also, so I think a lot of us probably did. I started out, I kind of fell into my position, honestly. I started as a reference librarian for the undergraduate side of the school. And eventually the position came open for a medical librarian. So I took that. And then over the years, just took on more responsibility and things and got promoted up to assistant director. So.
I can jump in next. So my name's Amy Baltus. I work for Sullivan University. I'm the liaison for the nursing and allied health programs. Librarianship is my second career. So I was in social services for 9 years and decided to move out of that field mostly because of work-life balance was really off. So I thought about what I wanted to do if I had all the money in the world, and the answer was be a librarian. So I went to IU in Bloomington and then ended up at Spencerian, which eventually merged with Sullivan. So I've taken kind of a roundabout way to get here. Yeah, that's it for me for this question.
Hi, everybody. Can y'all hear me okay? Okay. I was going back and forth between headphones and not. So yeah, I'm Billy Ann Gibb. I'm the Director of Library Services at Frontier Nursing University, and we're located in Versailles, previously in Hyden, Kentucky, down in southeastern Kentucky. I always knew I wanted to do special libraries, not necessarily health sciences. I worked in a corporate library when I was an undergrad, and really liked that. So decided to go to library school. I also went to UK. Actually, I don't know if Carly's still here, but I wanted to give a shout out as a fellow native East Tennessean now living in Lexington. So I got my graduate degree at UK, initially worked at a law library. When I wanted to move back to Central Kentucky, I took a job as an academic librarian, but it was a small college that had pretty specialized programs. They had a nursing program, so I worked with nurses there and with undergraduate nursing students. So it was kind of like everything kind of came together for this position. I had some experience with nursing, with nursing students, some experience with academics, experience in a specialized setting, and yeah, so here I am.
All right, thank you all so much. I love hearing how people got into librarianship because I feel like everyone has kind of taken a very twisty path here. So it's nice to hear that. My next question revolves around your all's job responsibilities in particular, because there are so many different things that librarians do and different kinds of librarians. So if you all could briefly go over some of your main job responsibilities so we can learn a little bit more about what you do.
I guess we can keep this order, so I'll just pop in first. It'll make it easy for questions. So as a hospital librarian, I work directly in the hospital. So a lot of my interactions are with nurses or physicians. I attend clinical meetings to provide on-site reference. I also work with patients and family members to provide any consumer health resources. And really, I just kind of manage the space that's in the hospital because we do have a little space where people can come use our computers and all of our resources there. But that's kind of the general idea of what being a hospital librarian looks like.
Well, my job is, well, I'm in a small institution, so you get to wear a lot of hats with that. So I do a lot of different things. Mostly administrative and reference work, mostly. I do lots of reports and statistics and all that fun stuff, working directly with faculty and students and occasionally preceptors out in the community. And recently I've taken over a lot more of the management of electronic resources. So that's been an interesting shift in duties. But yeah, lots of reference and lots of paperwork. and committees and things at an academic institution. So you're always doing that sort of thing.
I feel like I had a pre-COVID job and an after-COVID job. My position's kind of turned on its head a little bit. So prior to the pandemic, I was a solo librarian. The colleges of allied health and nursing are housed in a different facility from the main library in the main campus. So we were a really busy library, and it's just me. So I did spend a lot of time answering questions about Microsoft Word formatting and making copies, but it kept me really busy. In the meantime, I did all of the collection development and services for that library. So I had workshops too, and did some instruction within that building for the nursing and allied health students. So then pandemic hit and I didn't have any students walking into my library. So I had to kind of scramble to reinvent my position. And we lost at least half of the librarians across the board. So what that looked like for me is working with the librarians at the main library and then our Lexington campus. And we all had to collaborate on different subjects. So I'm no longer just health sciences anymore. I've been helping in other subjects as well. And we're talking about me taking on some instructional librarian duties because we lost that librarian in the staff reduction because of the COVID. So right now things are kind of in the air. We're definitely working as a team. But my job looks different every day. And that's one of the reasons I love librarianship, is because I just never know what to expect. And I love that about it. That's it.
Yeah, it is really funny how many similarities there are, but then differences. So I forgot to mention in my career path, I had a graduate assistantship working for the Department for Environmental Resources in Frankfurt. And so there, and in my first job, I was a solo librarian. And then when I was hired here, I was the only librarian. We now have a staff of 5. But I've been very, our school has grown exponentially, but I'm very used to being a solo librarian. And so my job now is as director. I mean, I am kind of, I don't do it all by myself. Don't get me wrong. I have a great staff, but I am kind of over everything. I very much like to keep a hand in reference and instruction because I don't want to lose those skills. And I feel like that's one of the most important things we do. But I do the ordering and, oversee management of electronic resources and collection development and all that good stuff. But it's exactly what Amy said. Every day is different. Lots of stuff to keep learning, which is another thing I love about the profession. And committees. Yeah, like Melinda said, if you are in an academic environment, especially if you're a faculty member, it'll be, a part of your role to be on committees, but it also, at least in my experience, to get people to remember about the library, you want to make yourself available on those committees. So yeah, lots of different things, keeps it interesting.
Thank you all. I really like hearing about the different kind of things, because you're right that everyone basically does very similar stuff, but then the day-to-day duties change all the time. So thank you. My next question is kind of about skills and things that you've had to learn. So for all the panelists, what is something that surprised you when you first started working at your job? And then what are some skills that you've had to learn to be able to perform those duties?
So for me, I think one of the things that was so different from like your perception of what librarianship is going to be is actually how much you kind of have to chase people down and kind of really show them what the library can offer. Because I think in your mind, we're all sitting there and, we should all have on glasses and our cardigans and we're just like these meek little individuals. But really within the hospital, I have to chase down nurses and doctors and show them like, I can help you. This is how I can help you. So I think that was kind of definitely a skill I needed to hone in on. I do feel like I've always had that personality. It was just a matter of making it come across professional and acceptable for those nurses and doctors. So that's kind of the major skill that I think is important to realize when you're going into an academic or medical library like that. But also just making sure your reference skills are honed in and you can do your lit searches and know how to, you know, make sure that everything is in order. So those are my basic ones. But
When I first started as a medical librarian, my biggest challenge was learning the language because medical schools have a completely different vocabulary than anything I'd been involved in before. So I had no idea what the difference between a block exam and a board exam was, and which exams they were required to take, and when they took those tests. And it was very daunting in that first year when I was still trying to learn all of the lingo. But since then, I mean, you just kind of learn stuff as you need to. You begin to develop that, oh, well, I don't know that, but give me a half an hour and I'll be an expert on it. So you just learn to be adaptable. Yeah.
Well, when I was fantasizing about librarianship when I was a social worker, I really pictured myself um, sitting at a reference desk and helping people who came to me. And like Riley said, a lot of librarianship is marketing yourself. And I thought, well, surely I'll be shelving books, and learned pretty quickly that's what pages do, and that's not what I do. But also, I just talk and I present more than I ever thought I would. So I'm not an extrovert, and I don't love presenting, although I think I'm getting better at it, and I'm enjoying it a lot more than I ever thought. But I remember the first week at this job, 9 years ago. Maybe not the first week, for at any rate, I had to present a new student orientation for like 75 students, and I was like, oh man, I just moved back home for this job. Was this a huge mistake? So I feel a little bad for those first 75 students 9 years ago, but I think I've gotten better. It's an important skill to be able to talk and present in front of people and not be terrified of it. And it gets easier the more I do it, so it's not so bad.
Yeah, still some similar themes, but I think I can add to it. So there's the changing technology that every librarian has to deal with and is going to have to deal with, and that is great. I mean, that's kind of, I feel like, what we signed up for, and like Melinda said, yeah, give me 30 minutes and I'll learn it, and I'll know it. But the other things, kind of what Amy touched on, I think, again, not to generalize, but I do have my cardigan sweater and glasses on. A lot of us are introverts, and didn't realize how much it was about relationships, chasing down those people and saying, I really can help you. Relationships with vendors is something I would have never thought about as a student. Maybe a little bit, because I did have that in my graduate assistantship. But the other thing I would mention is, I never, and I feel like a lot of librarians are this way, I never got in this to supervise people. That is not something I wanted to do. And that is, again, I grew into this position. I'm a director now with 4 people that report to me, and they're great and don't cause me any problems, but there's still paperwork involved and all that. That's just, I never thought I was going to be doing that. But again, to grow in your position sometimes and move up, that's what's required. And one more thing, the instruction. Yeah, I had done a lot of, or some small group and one-on-one instruction in my smaller libraries. When I got into an academic library, I realized, nobody ever taught me how to teach. I think maybe there are instruction courses in library school now, I'm not sure, but so that was a little daunting, but you learn it. And then honestly, when I looked at some things, I thought, okay, well, I know this from having had good instructors myself. How would it's not as easy as that. You have to think of different learning styles and all that. But so yeah, instruction was one for me. But I would, it was another one for me, but I would add that supervisory skills as well.
thank you again. I really like to hear all of the different kind of job duties and skills, because we really do have such a breadth of things that we have to do every day, and those things require different skills, and you're never going to find one person with the same skill set. So thank you. My next question is, we've talked a lot about change today and how things have changed over the past year and a half, but I kind of want to look into the future a little bit. So I know we have a bunch of different health sciences librarians here. We have hospital librarians, directors, medical liaisons in this panel. So I want to know where you envision your specific career path heading in the next 5 years, whether due to something unpredictable like a pandemic or just those predictable every year changes that Billy talked about.
Yeah, for this one, it's kind of hard to think about a little bit further. I really don't see my role changing drastically. I still think that in terms of going to clinical meetings, the only thing that might change is we have the hybrid option. So that's one thing that's really been popped in a lot with clinicals right now is they have the clinical or the hybrid option for people to join on Zoom, which has really helped increase attendance to some of our meetings. So I think that's going to be a major change. But in terms of needing to provide, I don't think my job's going anywhere specifically by any means. But that's kind of, yeah, I don't know. The change, I don't see it moving too drastically far ahead but like maybe in terms of technology and stuff like that. But yeah, nothing too crazy I think is gonna pop up in the next 5 years.
I agree. I don't think my position has changed tremendously. The most noticeable thing is just the way we communicate. I mean, I have a lot more Zoom meetings and reference and instruction, honestly, showing people how to use resources and things. And I don't see us going backwards from that. I think we've let that out, and it's going to just keep going. But beyond that, yeah, I think we're pretty settled. I like where we're at, and I don't see it changing drastically.
I don't think that I'll have as many collection development duties as I had pre-pandemic. I have a really nice collection of books in my library that no one's used for a year and a half. And I don't see them really coming back to that, unfortunately, because I do like the print, but like the DVDs, I don't know if they're going to be around much longer, and the print journals, I just have one left. So I don't think I'll be cataloging anything anytime soon. So that so the time that I used on those things will be shifted to instruction and some overlap with other librarians. We were really working as a team now, and I'm helping with LibGuides that I didn't do before. And I think it's more of a team effort with my staff anyway. That's how my job is changing, that we're all doing more and our lines are blurred a little bit. Like we used to have just one instruction librarian and one electronic resources librarian, and now we're all kind of spread a little thin. So we're all doing what we can. So I don't know if that's going to change in 5 years. I hope that it does. I hope that we can hire a lot more people, but until then, it's a really team effort in my library right now.
So we, as I mentioned, Frontier is a distance-based educational program. So all of our students were doing their coursework online anyway. So we're not quite, now the clinical side, that's a whole different issue. But for me, my job did not change all that much with the pandemic. And I know I'm very lucky in that regard. On the other hand, but I do see, let me back up. So they do their coursework online, but we would have students come to campus for orientations, and of course those went virtual as well. And so, Amy, we had this conversation in the library committee. I was like, oh, should we still subscribe to this print journal? Well, how often does it get used? I'm like, no one's been here in a year and a half. so it hasn't gotten used at all. So I definitely, yeah, that's definitely a concern. So I've always found this the 5 years question hard to answer in job interviews and so forth. So I kind of feel the same as kind of what Melinda and Riley said. The technology will advance, but we'll kind of be doing the same thing. I guess to kind of go in a different direction. I guess you ask about our job, and I guess this relates. I'm a little dismayed at the consolidation I see in vendors and publishers. And so I think that will affect, our purchasing, our platforms, our collections. So that's one thing to look out for.
Thank you. My next question kind of relates to the one that we just discussed, but because some of you said that you don't really anticipate seeing a ton of changes, I want to know what some unique challenges are for your specific role, whether that's challenges you anticipate in the future or challenges that you currently engage with.
Yes. Challenges has always been honestly just making sure that people know what is available to them. So we are kind of a special little library because I am employed with the University of Louisville. Technically, the University of Louisville Hospital contracts me out. So that whole explanation of, yes, you have access to these resources, but you have to come through me to do it, doesn't always get like the greatest response from physicians and nurses because they want their information fast and they want it now. So just being available to them and showing them that I promise that I do things quickly, like it's really no turnaround. Really just think of me as your personal assistant. Like that's kind of almost how you have to sell it, of you're just making sure that it's available. I promise you'll get it. But that's probably the biggest challenge that we run into. I'll say that nurses tend to definitely embrace our services a lot more. ULH has a great evidence-based practice and nurse residency program that they have, and they utilize me all the time. And I love my nurses and my chaplains. But the greatest challenge is getting those physicians in and understanding that, yes, I know you all think that you know everything and how to work everything, but I promise I can help. So those are, that's the biggest thing, I think.
Well, one of the biggest challenges that I've always had is our medical school is not affiliated with a single hospital. So our 3rd and 4th year students are literally all over the country. They're not close by where you can actually just have a meeting. But I think honestly, this last year and the changes in how we communicate has actually helped that a lot. So just trying to keep up with all the technology, and yes, trying to figure out how to get all of those physicians to come in or even just call or email or whatever, because sometimes they just don't. And so that's always a struggle, but hopefully, with the changes in technology and things, that will improve more as we go forward.
Kind of continuing what I was saying earlier, it's a challenge and it's also an opportunity right now. We're down so many staff members, but also we have the opportunity right now. It's a really great time to kind of rebuild our instruction program and our collection development plan. Like what is the new library going to look like? I think it's kind of fun because we've had people who have left, who have been there and I don't know, maybe stuck in their own ways might be a negative way to put it, but who are a little resistant to change, but now everything has to change and we get to rewrite it the way that we want to rewrite it. And I think we have a really good team. So it's a good opportunity to change. Yeah.
Yeah, so mine might be very specific. Well, but Melinda reminded me of a second one that apparently we share. So, but my first one is that we, as a nursing university, we have almost 2,500 students in head count, maybe 1,600 FTE. So when I talk with people who are used to dealing with med schools, for example, they're used to 100 residents a year. I don't, so, something like that. And I'm like, no, I need this for 2,000. So there's not a model, we did, but then yet, so you say, okay, let me look at a small college that has 2,000 to 3,000 people. Well, no, that's totally different too. And so it's hard to find benchmarks or to find, when you say, okay, we don't know how to do this. What do other libraries do? Well, we're so different. We can't compare ourselves to other libraries. And that is a big challenge. But exactly like Melinda said, and I didn't realize this, so I may want to talk to you more, but it's a community-based education program. So our students do their clinicals in the communities where they live, which is all over the country. And so they don't, it's the same thing. They're not here. They use our resources, and that's great. And you may not have this problem, but they want to also give their preceptors access. They don't understand that see, you guys get it, right? Doesn't anybody else that our agreements don't allow for that. And so in that specific, like I said, clinicals are different than the coursework. In the clinical situation, it does create a lot more challenges.
Awesome, thank you. So it looks like we have time for one more question. And I think this is my favorite question, just because after the last couple of years everyone has had, I think we need to talk about things that bring us joy. So would you all mind telling everyone your favorite part of your career or something that has brought you joy specifically in the past couple of years?
So mine is honestly, I love working with my chaplains. They are some of the sweetest people I think I've ever met in my entire life. And one of the things that I love about working with them is that, one, they're so understanding and they're so grateful for everything that you provide for them, which kind of leads me to my favorite part of the job is just knowing that I helped somebody and getting that reassurance of everything that you sent to them was perfect and you couldn't expect, like, they're just so ecstatic. Or someone who walks into the library and realizes, oh, I can come down here and chart. Like, I didn't even know this was available to me. So really any of those, like, just like making me feel happy and reassuring that I'm doing the right thing. I like praise. I really do enjoy that. It's one of my things. That's why I went into it. So the instant, like, thank you really just brings me a lot of joy. And I just really love my job. So
I have to agree with that. One of my favorite things is getting cards or emails from former students even that are in their residency that are, thank you so much, for helping me with this. You're wonderful. And, we all like praise. It's a great thing. The other thing that really comes to mind is that there are a lot of changes on a daily basis. I mean, your reference questions and things are just all over the place. So I don't get bored. There's just always a lot going on and a lot of new things to learn. So I really enjoy that part.
This is, at the risk of sounding cliche, I love learning something new every day. And honestly, in this job, I learned something new. Either I didn't know or I improve upon a skill every day. And what's not to love about that? I mean, it's very rewarding. Yeah.
Yeah, I can definitely add a me too to the praise thing. It's so nice to give some, to have, oh, thank you, this helped me so much. And I sometimes think, maybe I was at my happiest doing document delivery because, somebody wants X and you give them exactly X and, and we're good. So yeah, I enjoy that too. And I also agree with Melinda. It's never been a boring day on the job. Maybe if I was in a meeting, but no, never a boring day. I do really enjoy working with nurses on the personal side. If you have a sniffle, like they're right there. What do you need? Like here's what you should take. They are, it's a part of their culture that they're carrying, and that's nice to be around on a daily basis. And I don't want to get sappy either, but I really like other librarians. I mean, I kind of, without fail, whenever I've been to something like this, I go to another librarian with, a question. They're always, here, let me take my stuff. Let me tell you what I did. Just the poster when I asked about the tutorial, and she said, "Oh, sure, just contact me." So that is really great, really reinforcing that I chose the right field.
The other thing, just really quick, that brings me joy is teaching someone that, like in CINAHL or PubMed, they have the cite feature, and you would think that I had just changed their entire world, and it just makes me so happy.
When we show RefWorks, we get that. Yeah.
I think it's Clinical Key's presentation maker for me. People are fascinated.
That's amazing. Thank you all so much. I love ending on a happy note. So with that, Stephanie, do you have anything to say before we break?
I think this conference has been wonderful. All the sharing of knowledge and learning more about all of you has been very, very interesting, and I've really enjoyed it. And we're going to take a short break and come back at 4 for trivia. So Kayla has prepared trivia for us. What is it? Pop culture?
It is pop culture.
Pop culture.
I apologize. It might be very specific because I created some of the questions on my own. And there's an incentive. We'll have a winner, and that winner will be very pleased, I think. So please come back for trivia.
Yeah. So we'll wrap up the conference with trivia starting at 4 o'clock.